Professor Dr. Srilata Pele, PG College of Nursing, Vice Principal, PG College of Nursing, Bhilai. Principal and faculty members who have come from distinguished colleges all over Chhattisgarh, and my dear colleagues. On this memorable day, I, Professor Dr. Jaya Chakravarti, feel a thrill of joy and a supreme sense of satisfaction along with feelings of genuine pride. It is with great deal of pleasure and a sense of privilege that we extend a rousing welcome to all of you to this competency-based education training for nurse educators sponsored by Pandit Deen Dayal Upadhyay Memorial Health Sciences and Ayush University, right? Vital in nursing as it ensures nurse possesses the necessary skills and effective patient care, thus reducing the risk of errors and adverse outcomes. Nursing practice constant ensuring they can deliver evidence-based care. In this regard, it is my pleasure to introduce our esteemed guest speaker for today's workshop at our nursing college, Mrs. Anu Grover, Program Director, NRSC, SGT University, Gurgaon. Madam Anu Grover embodies the essence of passion, loyalty and commitment in her role as a dedicated employee. With 11 years of rich experience in the field of obstetrics and gynecology nursing, she stands as a beacon of knowledge and inspiration for both students and professionals alike. Currently pursuing her PhD in OBG, Mrs. Grover holds a Masters of Science degree in the same field, showcasing her which simulated teaching methodology, obstetrics and gynecology education research reflect her expertise in the motivation. Mrs. Anu Grover's research interests span across critical areas infertility and high-risk pregnancy. Her prolific academic evidence portfolio communications in workshops. As a passionate educator and researcher, Madam Grover is not only committed to advancing the field of nursing, but also to nurturing the next generation of healthcare professionals. Her dedication to creating a conducive learning environment where students feel comfortable for optimal learning speaks volumes about her commitment to their growth and development. Today, we are honored to have Mrs. Anu Grover join us as our guest speaker, where her expertise and insights are sure to enrich our workshop discussions and inspire us today. Excellence in nursing. Please join me to extend a warm welcome to Mrs. Anu Grover, whose presence promises to elevate our learning experience and ignite our passion for nursing. I welcome Madam for the session, Teaching and Assessment of Clinical Skills. So, good morning everyone. Dignitaries, audience, First of all, I would like to thank for the brief introduction and the opportunity I got here to be the resource person for the very important and the topic which is the talk of the town these days, that how we are going to teach a skill to our students which we are doing since long back, and how we are going to evaluate the student based on the OSCE methods. So I believe many of you must be conducting the OSCEs. Can I have raised hands who are conducting OSCEs in their around institutes? 1, 2, 3. So we have many hands raised here who are conducting OSCEs. So you must be having some idea that how we are going to conduct the OSCEs and how we are teaching the skills. So skill teaching is not something new I'm going to talk on. It's not something which I am going to teach. We are going to have a discussion all among so that we can learn from each other. So what is your exposure? What you know about the OSCEs? Your checklist, what you know about skill and how to let it practice with the students. Rather, we will be focusing more on how we can make it standardized for each one of us. So it is going to be very easy for the students whenever they are going to deal with the teachers, so they are not panic, and whenever they are going to the other institutes, it will be easy for them to make it standardized everywhere. Right? So all are ready for the session? Yes. I just want to give you a brief about what we are going to cover during today's session for next 30 minutes. So first of all, we'll be talking about what is checklist, what is skill teaching and practice, how we are going to use it, and what is the importance of that. In the next 20 minutes, we'll be talking much on the OSCEs, that how we are going to evaluate the skills which we have taught to our students, because assessing the skill is equally important as we are teaching the skill and as we are allowing the students to practice, because this is the way we understand as a teacher that how our students and what content and what extent they have learned, right? So I will be talking with the importance of procedural checklists. So first I would like to ask from any one of you, why do you think when we are teaching a skill to the students, we should use the checklist? How many of you think that we should use the checklist when we are teaching the skill? What is the reason, ma'am, we should use the checklist in that? Very good. So it is like important that we are not missing any important point in the checklist, because as a teacher, if we miss something, definitely the students have the tendency to miss that particular step. Anything else? Anything else? What is the importance?
To be in sequence and to be in the right sequence.
Yes, very important. So it is not about that we are teaching something. It is important that we are teaching in a sequence. So what is the sequence we have to follow? If my student is supposed to touch a student, it is very, very important I should ensure that the hand It is very important that I should ensure my students safety measures to the patient. So that is very important to give the sequence. Any other point in the importance?
It's a record that these things were done. Record as a record.
Okay, yeah, very good. So that's a very good point ma'am has highlighted, that we are keeping a record when a teacher is doing something, we whether done or not done. And same thing when my students are practicing among, because when you teach something, you are not able to make sure that you are with every student every time. So you are giving the peer practice to them. So you are giving the same checklist which you have prepared for your students. They can go and they can themselves practice from that particular checklist which you have provided to them. And one peer is evaluating the other peer when they are practicing. Suppose I have taught a topic on pulse, then I am giving the same checklist to the students. So then they are practicing amongst. So when they are practicing amongst, there's one student is evaluating the other student and they can make a note that what is being done and what is being missed. So they can make a note from the proper checklist they have in their hand, so that they are sure that they are not missing any of the points in that, right? So I'll be taking you around what is the importance of checklist. So if we see, a procedural checklist is a list of steps which we use, which we follow in a given correct sequence. As ma'am has rightly mentioned that there is a sequence. It's a list of procedures or the steps which have the correct sequence, and these are needed skills correctly. Correctly means we are not missing any of the single important point in that, because we have a list with us. So it helps to ensure the consistency. So what do you mean by consistency here? What do you want to say about the consistency here? Then I'll give you an example about it. Can somebody talk on the consistency? How we are ensuring that one is using the checklist, one is using the procedural steps in their hand, they can particular topic. How can you ensure that? Very good. This is not for students first. This is for teachers. So one teacher is teaching a pulse procedure today, the other teacher in her absence is teaching the same procedure next day. So there is a standardization. So it is like, today I am teaching something, the other teacher will teach. Because it's not something is teaching something wrong, but students get confused easily. So it is easy for the teacher to be consistent, be standardized what they are teaching, and it is easy for the students to recall, because students what they think, this man has taught this way, you are telling this way, so they will be confused because they don't have much experience to relate. Teachers have much experience, teachers has an idea that what is the logic I am giving, but students are not able to comprehend many times. So it is important for a teacher whenever they are teaching with the same checklist. So in particular college, if I am dealing with my 100 students, so we have 4 teachers who are dealing with 100 students, so we follow consistent to teach the same procedure in a same manner and in a same sequence, right? So it is helping us to be consistent with the things. So we are also ensuring that there is no step is being skipped, because we are correcting it. Whether the step is done, we are making it marked. Whether it is not been done, we are not keeping it, right? Completeness in carrying out the task. So we are not going. So today, if I am teaching one starting from the and I am ending at the disposal of waste. So next day, we are ensuring the whole task is being taught to all 100 students rather than to all 50 students, which is being taught by the. So we are ensuring that the task is being completed. So next is, we are making sure the students are learning independently. How it is going to help the students to be independent here? If we have a checklist, we will give to the students, and students does not need anyone to be observed. Students does not need anyone to be taken care by the teacher, so they can learn in a peer. They can learn independently, because the correct sequence, correct checklist you have provided to the students, that is a help for them. So this is what the students are going to learn. Ensuring the clinical practice guidelines are being followed. So whenever you are preparing a checklist, you will ensure that the proper guidelines, proper protocols are being met, and this is the way students are not skipping any of the points
points, and this is where this checklist, the procedural checklist is going to help us. So, ultimate goal is, what is our ultimate goal? Patient outcome. It should be a better expected outcome. So when my students are so consistent, when my teachers are so consistent, when my students are not missing any point, when my students are practicing this independently, this is going ultimately help them to get the things into the muscle memory. It is not going, that is going to be a habit of the students. Can you recall during COVID, we all were very much familiar with the hand washing steps. That is the only time which taught us, because that we were doing it multiple times. So when you give the checklist to the students, it is ensuring the students to get the things in their heart, to get the things on their tips, to get the things on the muscle memory, so they are not forgetting whenever they are going to the patient, and whenever they are giving their exams, they are getting the things done properly in a more consistent and sequential manner. Agree? Right. So moving further, I just want to give you a brief demonstration on how to teach a skill to the students. So I need some of the volunteers, if 2, 3, 4 people can come forward, and then we can do this procedure just in 5 minutes. Any 4 or 5, any volunteers? Can you have 4 or 5 teachers? अनुमान ये चेयर यहाँ लगा So can I ask you to wait here for 5 minutes? Can I wait one more person? Can we request you to wait for 2 minutes also? Hospital, and we can teach the whole skill all together for all 100 students or 50 students on the same time. So what will I do? I will bring my patient in the classroom from the hospital. So we will give the patients a briefing about that, what she is going to do and how she is going to do. So please understand how I am pre-briefing my patient, because I am preparing the patient in the classroom. So I will be getting ready before my students are entering for the procedure to learn. Akanksha. So are you ready to be? Are you okay with this? So I will be taking a brief consent from the patient. Just see what I am doing, and we will discuss later. So ma'am, are you okay to be my patient? So ma'am, today what I am going to do, I am going to teach a skill to my students on pulse, how to take a radial pulse. I will not take more than 5 to 10 minutes, because there will be 4 to 5 students. They will be checking pulse on you, and they will just do for the sake of the skill. So are you okay with that? So Akanksha ma'am, whenever I am asking in front of my student, what is your name, you have to say Akanksha. What is your age? Okay, we consider your age is 40 years. So you are a Kansha, 40 years of age. So if I ask in front of my students, for what purpose you have come to the hospital, you have to say, I was not feeling good, I was feeling nauseated, and I was feeling feverish. So what do you have to say? So this is what we have a standardized patient with us. So we'll be doing the procedure on this patient and we'll be briefing about things. So before we are moving further, I just want to know, can you read me the first definition of pulse? Yes, so it is checking presence, rate, rhythm and volume of throbbing of an heartbeat. So ma'am, can you read me the purpose? First two purpose.
Determine number of heartbeats occurring per minute rate to gather information about heart rhythm and pattern of beat.
Okay ma'am, can you read the next two?
To evaluate the strength of pulse. Next, pulse is heart ability to deliver the blood to the distinct area of the blood via finger and lower extremity.
Okay ma'am, can you read the next two?
Blood cell response of heart to cardiac medications, activity, blood volume and gas exchange to assess vascular status of limbs.
So these are the purposes we are checking the pulse. As you are well versed with it, this is a routine procedure. It's the main important vital sign which we are using from the students, and you know the rationale behind this. We'll be dealing with the procedure one by one. So what are the different types of pulse are there? Otherwise, apical pulse, thoracic pulse, radial pulse. So today we are talking on how to take a radial pulse. So we'll be dealing only one pulse which we are taking for this particular patient. So what are the equipments we need? So we should have one standardized patient with us. We have a standardized patient with us. And what are the equipments? A clean tray containing the hand rub. For hand washing purpose, if you have a hand washing area, you can go and check with that. And we should have the watch with the second hand because we are going to check the pulse quality, and this is for the declaration. So these are the articles we do. So now can somebody read me the first step one by one? So wash your hands. So when I'm saying wash my hands, I have to take out the all ornaments. I have to wash my hands. So can we follow these steps? Can you do the steps with me? So what is? We are taking the soap and water. So we are taking the hand rub here in ample amount. So what we are going to do? The first step is palm to palm, back to palm on both sides. Then fingers interlock. Then can you do the steps with me? Can you do the steps with me? Fingers interlock. Then tips. Right? Both sides. Then we have to do interlocking. That is a knuckles. We are cleaning both sides. Then we have to go for the thumb rotation, and then we are cleaning the. So we are making sure the hands are right. So you are already called with all 6 to 7 steps. Right. So what is next? Why we are using the hand washing technique? Why we have to follow wash hands? To prevent infection to myself as well as to my patient. Okay, what's next? Prepare all. So our equipments are ready. We have already prepared. What's next?
So it's a patient identification.
So we are checking the patient identification. So how we are going to check? So first of all, what's your name? Akansha. So I'm checking with my file. She's Akansha. I'm checking the badge number as well as I'll be checking the tag number if patient is already having. Okay, what's next?
Explain the procedure and purpose to the patient.
Very good. So now we are going to explain the procedure and purpose to this particular patient. So Akansha, good morning. So Akansha, I'm your nurse today. So Akansha, may I know what is the problem you have? Why you have come to the hospital today?
I'm not feeling good.
You're not feeling good since morning, okay?
I'm feeling like nauseated
You have been nauseous since?
and little bit feverish.
Feverish. You're feeling feverish. You are little warm, right? So don't worry, Akansha, I'm going to check the pulse. As doctor will come, I will report to him that it's a normal routine procedure which we should do for the patients whenever the patient comes to us. So this is normal vital signs. I'm going to check the pulse. So are you okay with that? So be comfortable, don't worry. Okay. So now we have told the procedure which I am going to do. But before that, I have introduced myself. It's very, very important to tell to me. So can you read the next slide?
Assess the patient is usually a supine or sitting position. If supine, place the patient forearm straight alongside
Ansha, are you comfortable sitting or you want to lie down? You are comfortable sitting? So patient is comfortable in sitting. So ma'am, can you read me the next step?
Count and examine the pulse. Place the tip of your fingers, index and third finger over the patient's radial artery on the inside of the wrist on the thumb side.
So now what I am going to do, I am going to check her pulse. So please come forward. So we'll be checking the pulse of the patient. I am making her comfortable. So I am keeping my 3 fingers, index, middle and ring finger on the thumb side. So why we are checking what is the thumb side? The radial pulse is present or available at that area. So we have to ensure everybody is able to see where I am keeping the hand. Okay, so I am going to count the pulse for next full 1 minute. So I am checking the pulse for full 1 minute. I am observing the clock and I am checking it. Okay. So I am considering 1 minute is over. I am considering 1 minute is over. Are you comfortable? Okay, what's next?
Apply enough pressure to the radial pulse.
Okay, so we are not supposed to press hard. We have to check the pulse as per if it is required whenever we are getting the pulse. Okay, what's next?
Watch to count the number of pulse.
Yes, yes. We have to count it for full 1 minute. So what is the reason behind that? Why we are not supposed to multiply it with 4 after 15 seconds? What is the reason? There is a regularity or irregularity we can find out. So it's not our aura to check the pulse or the number of beats. It's about we need to understand if there is a pulse is regular. Anything else we are checking by continuously monitoring? Volume as well as how the rate is there. So we are checking the rate, rhythm and volume. So that's why we have to count it for full complete 1 minute. So what is next? So we have to check the volume, that is strength of the pulse. Also we have to check whether it is bounding, whether it is normal, whether it is feeble, whatever. What is next?
Plot the rate on the patient's chart.
So now I will be recording. Just consider. We have mentioned the name of the patient, we have mentioned the complaints, we have mentioned the rate, rhythm and so we have to write. Right? If any other problem patient is having, we have to write. What is next?
Report to the senior staff if you find any error.
So the patient pulse is okay, you are fine. So we are just reporting if anything abnormal is there. And then again at last we will be washing the hands in all the steps and replacing the articles, whatever has to be disposed, we have to dispose. You got an idea? Thank you. Thanks a lot everyone. So now we can just have a small discussion. So what we have done, what do you understand what we have done? Can somebody just give me a brief what we have done here? Who would like to? Okay. So what we have done the procedure on checking the radial pulse. So we have done the procedure on checking the radial pulse. So in that, what are the components we have included? How to pre-brief your patient. Did you get it? How to pre-brief your patient. So pre-briefing of the patient is never in front of the student. Why is it so? What is the reason? Why should not we pre-brief the students with the patient, or why should not we pre-brief the patient with the students? It's both ways. Can somebody tell me what is the reason that we should not standardize our patient in front of the students? What do you think? Why I have asked or requested them to go out? Yes, we will miss the realism. Students will think that something is like being dramatize over here. They will not consider that this is an actual patient. So whenever we are preparing our patient, we have to ensure the patient is pre-briefed when the students are not here with me. Right? So whenever we are teaching a skill, we have to take their previous knowledge, we have to understand what they know about the content, and we have to involve the students as much as we can. So how do you think I have involved them? So I have just started action. I just wanted to make them comfortable so that we know each other. Right? What is next? So I have talked about the steps. So I have requested each of them to read me the steps. What is it going to help you? Because you are not going to deal with 4 students. You might be dealing with 12 students altogether as a group number. So when you are dealing with 12 students, what will happen? Some students are with you and some are somewhere else. They are physically with you but they are mentally not with you. But what happens when you involve everyone to read a step for you? They are all prepared and alert that we may read the next step. And sometimes if my student is not alert or attentive, what will you do? Will you scold the student? No. What will you do? We will ask you questions related to what? So what we have discussed or what we are discussing. So many times what happens? If somebody is not focusing, okay, what are you doing? Why you are not here with me? So that psychological safety is being lost somewhere. Student feels scared. Students are not feeling teacher is approachable. So if you keep your student busy like this, involving them with all the things, it will be easy for us to make sure that everyone is with me and everyone is attentive and alert. And also when we are dealing with some of the small procedures like hand washing. Hand washing is not my component here, but when I am doing hand washing, I am involving the students and I am ensuring that they know the steps of hand washing. So it's better to involve the students in multiple times. So whenever you are doing the procedural checklist, use your students to read the steps for you. It will be easy for you as a teacher to not to skip anything, and it will be easy for you as a teacher that not to learn anything. You are just going with the checklist and you are asking the student to read for you, and that skill you already have as a teacher. You know how to check the pulse. But you may miss something. What is the next step I have to do? So this is the easiest method when somebody is reading for you and you are doing the procedure for the students, and then you can demonstrate the skill effectively. Do you all agree? Yes. You all understand? Any questions, any queries regarding the teaching of skill, we can just discuss in just for 2 minutes. Anything you want to add which I have missed maybe? Anything? Any volunteer can just add on what you want to add. Okay, then shall I ask one question? Can somebody just tell me how I have pre-briefed my standardized patient? What are the things I have ensured with her? What are the things I have ensured with her? Very good. So I have taken the consent. Very important. So it is not she is your student and she is obliged to do with the standardized patient. She might not be comfortable. She might not be okay. So we have to take the consent from that particular person. Are you okay to be my patient? So she said yes. What is the next thing I have ensured? That we have taken the consent, whether she is comfortable or not. What is the next thing?
Information about the client.
Sorry?
Information of the information.
Yes, very important point. Whatever you are saying, just take it back. Close the loop. Very important. What you have told to your student, you have to take it back. What I have given you the age, let her say 40. What is the name I have given, let her say. So whatever you have told, ask the student say again to the teacher, so that you are sure and she is sure that we are on the same page. Right? You got it? Anything else we can do with this? Anything else? If I am giving her a brief introduction or history, that your name is Subramaniam and the big. So big names. So will it be easy for her to recall? Keep it crisp and short. Don't give them much long. Pulse check करनी है, which we can check with any of the patient. It is not a complicated procedure. So don't keep your briefing complicated. Keep it simple as you can. Don't keep it 5 days back you were having already fever and this is the medication you are taking, and this medication you are taking 3 times a day, and this is the problem you were having 5 years back. So don't keep the history prolonged unless it is required. So keep it short and easy and simple so that the patient who is acting for me as a patient with the fever, that she is able to recall and she is able to answer you when she is dealing or when the students are there with you. So that is very, very important. Taking a consent from the standardized patient, confirmation of the information you have given, and keeping the information crisp and short, which is easily recognizable for the patient. Sometimes, what is the questions I usually get from the participants, that sometimes we have to do the complicated procedures. For what we will do? Because every time we are not going to teach the pulse. Sometimes you have to give the long history. So what will you do in that case, being a teacher? फिर आप क्या करोगे उसमें? अगर मुझे बहुत सारी, everyone is comfortable in Hindi and English both? Yes. So if I have to give lots many history to that particular patient because that is required for my scenario, फिर आप क्या करोगे उस केस में? What will you do? She may forget. What will you do? Very good. So we will give in return, we will give a slip that if my students are asking something, then only you have to answer out of it. Students again, if my students are asking you, then only you answer. Don't give the history just asking by the name, because that again will not help me as a teacher to evaluate whether my students answer particular questions or not. So it is very, very important for a teacher to prepare your standardized patient in a manner that the patient should look standardized and the patient should be informed clearly. If I ask you this question, if my students are asking this question, then only you answer, otherwise you don't answer. If we are clear with this? Sometimes you know what happened? You tell something and they tell something. आपने उनको बोला fever है, पर उन्होंने कुछ और बोल दिया. So what will you do as a teacher? I have told Akansha ma'am, you are down with fever, or you are feeling feverish and you are having nausea. What if she would have told I am down with diarrhea? फिर आप क्या करते being a teacher? ऐसा हो सकता है ना? It's very possible. It happens with us many times. We have conducted so many trainings. हमारे साथ बहुत होता है being a कि मैं क्लास ले रही हूँ और मैंने अपने पेशेंट को ऐसे प्रिपेयर किया, स्टूडेंट because they might be friends. You understand? Every time you will not get a teacher to be your standardized patient. You have to take the student from the particular group. So what will you do in that case? So in that case, we call it a lifesaver. In that case, you as a teacher are going to correct. You were down with fever, earlier we have just spoken. So you are going to save the scenario if it is going to disturb your things. But if she is down with fever, if she is down with diarrhea, how does that matter? I am checking the pulse, so I will be quiet. But if it is disturbing my scenario, then I have to be the lifesaver. That we will discuss in detail in the simulation scenario, evening and tomorrow. So I am not going to give much elaboration on that, but I just want to give a gist that how we have to prepare our standardized patient, how we have to use the checklist effectively when we are teaching a skill, and how we are making sure the students are doing the steps in a consistent manner and they all are involved with me when I am teaching the skill to them. Are you okay with this? Anything else you want to share? Nothing? So what we are going to do now, we are going to disperse, or what we are going to continue?
एडिशनल क्वेश्चन आई थिंक आप लोग क्वेश्चन कुछ नहीं पूछ रहे और यू वांट टू शेयर एनीथिंग इफ यू डोंट हैव आई हैव टू क्वेश्चंस but I want you people to ask questions. You should interact more. Why के सुनना नहीं because you are doing in the routine life every day you are interacting with you are teaching like you are acting like a modern 10-year experienced teachers all of you are.
Please feel free to ask anything. Sometimes silly question भी आ रहा होता है mind में, वो भी पूछना होता है. So no question is silly question. Please ask like a student. So you are here, we all are here as a student. We are going to learn from each other. So please ask if you have any query. Whatever the silly question comes to your mind.
Or you want to share any experience.
So how many of you are preparing the patients and doing the checklist procedures?
कोई कुछ नहीं बोलेगा. Yeah, please, yes.
Yes, very important. Very, very good point. Ma'am has highlighted. Thank you, ma'am, for the highlighting this point. So this is very important thing. We have to ensure that in which language my patient is comfortable. Whether he is comfortable in English, whether he is comfortable in Hindi, or whether she is or he comfortable with Punjabi or other language. So that is very, very, very important. The thing to be ensured with the patients when you are dealing with different kinds of people all around the states or all around India. So we have to ensure. So when we are dealing with daily routine, we are sure that they know Hindi, they know English. But it is always good to ask and confirm in which language my patient is comfortable. That's very important. Thank you for highlighting this. Anything else you want to add? So no questions. Ideally दो reasons की वजह से होते हैं. या तो सब clear हो गया या सब clear हो गया. So कौन सा वाला clarity आया है? You got an idea? So anything you want to have, we are there only for next 2 days. We can discuss anytime. जब भी कभी बाद में भी mind में आता, you can ask individually any one of us, me or me. Right? Okay, thank you. So I think we have been knowledge.
So my question is, all of you is, when we require standardized patient, do we require standardized patient for all the procedure? कितना procedure पढ़ा है first year के there are many one. For all the procedure do we need a standardized patient? हाँ है ना तो बोलो. Yes or no?
Yes.
For all the procedure. So when we teach IV cannulations, we really require a standardized patient always. Just 1 second before everybody said yes. So being a teacher, we need to identify when we require or when we not require. That's what. Acha, the second question is, if you require a standardized patient, where do you get the standardized patient? कहाँ से मिलेगा? जोर से बोलिए. क्लासरूम से? ये सर क्लासरूम से. अगर क्लासरूम से कौन? और what is? Teacher? Ma'am, we can hear you. जोर से बोलिए. Yeah, of course. So we can make students, we can make our colleagues as a standardized patient. Yeah. Thank you. Any additional things? Please ask. Please. Maybe it will be very simple. Please ask. Feel free. We should have a common dialogue in NRS. Whatever happens, whatever things asked here, it will stay here. It will not go somewhere. Be comfortable.
So
Nobody is going to
don't
judge you.
feel that I should not ask this question. Please feel free to ask. It is going to help each one of us. We will also brush up our things that we can add something next to the classes, and this will brush up you for the further when you are going to deal with your students. This is my humble request. Feel free to ask. Be psychologically safe. Whatever we are discussing here, nobody is going to talk outside. That whatever the questions are being coming to us. So please ask anything whenever you feel. Right? Okay? Yes, ma'am.
Education attains its highest form if it becomes a tool of service. Respected our honorable guests of today's occasion, Dr. Rajesh Rishikar, Registrar in Charge at Examination Control, Pandit D. Dayal Upadhyay Memorial Health Science and Ayush University, Raipur, Mrs. Durgavati Kunjan, Registrar, Chhattisgarh Nurses Registration Council, Nagpur. Our guest speakers, Mrs. Anu Rohar, Program Director, NRSC, SDT University, Gurgaon. Mr. Linto Andrews, Advisor, Nursing and Midwifery at Japaigo. Mr. Surendra Gupta, Secretary, Bhilai Education Trust. Professor Dr. Avinika Vishwan, Principal, PG College of Nursing, Bhilai. Professor Dr. Srimata Pillai, Vice Principal, PG College of Nursing, Bhilai. Principals and faculties who have come from distinguished colleges all over Chhattisgarh and my colleagues present here. On this memorable day, I, Professor Dr. Jaya Chakravarti, feel a thrill of joy and a supreme sense of satisfaction along with the feelings of genuine pride. It is with a great deal of pleasure and a sense of privilege that we extend a rousing welcome to all of you to this competency-based training for nurse educators sponsored by Pandit Deen Dayal Upadhyay Memorial Health Science and Ayush University, Raipur. Competency-based training is particularly vital in nursing as it ensures nurse possesses the necessary skills and knowledge to deliver safe and effective patient care, thus reducing the risk of errors and adverse outcomes. Demonstrating proficiency in key competencies can enhance nurses' opportunities for career advancement such as promotions, specialized roles, and leadership positions. Overall, competency-based training in nursing is essential for ensuring patient safety, maintaining quality care, fostering professional development, and advancing the nursing profession as a whole. How to express in simple words what we feel about our mentors and guests present here today, who make the occasion a beautiful, glitzy, and worthy of the celebration. I think the best way to articulate our feelings is through a welcome song. I invite the choir group of our college for the welcome song. Thank you, students, for this beautiful song. Saplings symbolize growth, renewal and hope, reflecting positive sentiments and the beginning of a fruitful relationship with the guests. I request our principal, Dr. Abhilika Biswal, and Vice Principal, Dr. Srilata Pillai, to welcome our guests with saplings. Thank you, madam. Astu ma sadgame, tamaso ma jyotirgame, mrityu ma amritangame. I request our honorable guests on the dais to light the lamp and mark the beginning of this function. Thank you, ma'am. Thank you, sir. You can dream, create, design the most wonderful place in the world, but it requires people to make it a reality, an apt hand to pass the baton and continue to excel in which you gave form to. I request our Vice Principal, Professor Dr. Srilata Pillai, to deliver the welcome address.
Thank you, Jay. A warm good morning to one and all present here. Education is not just the acquisition of facts, but training of mind to think. I am Srilata and I feel incredibly privileged and honored to welcome you all to this unique 6 days competency-based training program for nursing faculties sponsored by Pandit Dindayal Upadhyay Memorial Health Science and Ayush University, Raipur. This program provides a platform for nursing teachers to align themselves with the newly revised competency-based nursing syllabus, simulation training, OSCE, followed by the development of leadership topics, forensic nursing, research topics, etc., covered by national trainers and experts from different states. Competency-based education focuses on assessing and mastering specific skills, and simulation plays a crucial role in this by providing realistic scenarios for learners to apply knowledge and practice skills in a consolidated environment. At this outset, I most respectfully welcome our today's chief guest, Registrar in charge, Dr. Rajesh Pisikar sir from Pandit Dindayal Upadhyay and Ayush University. And actually in a university meeting in the presence of Dr. Hishikar sir and our ex-Vice Chancellor Dr. Ajay Kandakar sir, I casually asked them whether we can conduct a workshop for teachers of the entire state of Chhattisgarh. Sir told you people can do it and prepare a proposal and submit to us immediately. I discussed with Principal Professor Dr. Abhinita Vishwal and she told if possible you go ahead, and with the guidance of our principal and support and with our cooperation of all senior faculties, we submitted. And sir was kind enough to get it sanctioned immediately. His insight and presence have truly enriched this program. Sir's creativity, commitment, quality, and flexibility are the key elements of his success. His dynamic personality, and he always strives hard and encourages the entire medical professions. Your presence as a chief guest would not only honor us, but also underscore the significance of such initiatives in enhancing the quality of nursing education. We heartily welcome you, sir. I would like to extend a special welcome to our guest of honor, Mrs. Durgavati Unjam, Registrar, Chhattisgarh Nurses Registration Council, Raipur, whose presence in today's program adds value to all nursing faculties attending this competency-based education program. In spite of her busy schedule and with short notice, she was kind enough to accept and grace this occasion with her valuable presence. We welcome you, madam. It's my privilege to welcome Mr. Linto Andrews, Advisor Japaigo Nursing and Public Health Professional. His experience in policy advocating and government licensing adds immense value. Sir, from the core of our heart, we heartily welcome you. We heartily welcome you as you have supported us for organizing from objectives and scheduling as per the requirement and connecting virtually with each trainer and guiding them to organize in such a way to meet the desired objectives to the utmost benefit of our participants. You are a source of guidance for us. We welcome you, sir. We are also delighted to welcome Ms. Anu Grover, Director of National Simulation Center, SDPT University Gurgaon, for her commitment towards training simulation skills among participants, and in spite of her busy schedule has spared her valuable time for adding knowledge and developing skills among our participants. You are really a source of inspiration for us. We welcome you, madam. We also welcome Shri Surendra Gupta, sir, Secretary Bhilai, who has dedicated his time and efforts towards the development of this college. Your contributions are highly appreciable. Welcome, sir. We warmly welcome Professor Dr. Abhinita Vishwal, Principal of PG College of Nursing, for her unwavering support in organizing this workshop with utmost dedication and motivation. Her untiring efforts is the cornerstone of organizing this competency-based education program. We welcome you, madam. We are heartily grateful to Dr. T. Dilip Kumar, President Indian Nursing Council and ex-nursing advisor to Government of India, because without his support, we were not able to make out the simulation and OSCE sessions, and he has debuted to national top level experts by which we are able to meet our desired objectives. We extend a warm welcome to all the dignitaries, principals, senior faculties, participants in attendance, and all members who had directly or indirectly contributed for organizing this program. Together, we can make a difference. Wishing you all the best for all the 6 days program. Jai Hind, Jai Bharat, Jai Chhattisgarh.
Thank you, ma'am. United we stand, divided we fall. Indeed, it was this mantra of working together what has brought us today where we are. I would like to invite our respected principal, Professor Dr. Abhinika Vishwal, scholar and navigator of the flagship of knowledge, to deliver the keynote address.
सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् नादुर्भवेत्. That means our motto of life is to get happiness. How? With your health and with your satisfactions. So very cheerful good morning to one and all present here. Let us have a huge round of applause for all of them on the dais. And that is what our most respected Honorable Chief Guest, Dr. Rajesh Sulzikar, Madam Durgavati Kunjam, Registered Chhattisgarh State Nursing Council, and Sri Linto Andrews, Japaigo Advisor, Nursing and Midwifery, and Madam Anu Grover, Program Director, that is on National Reference Simulation Center, SDT University, Gurgaon, and our Secretary, Bhilai Education Trust, Sri Suresh Gupta ji, and our Vice Principal Madam Dr. Srilata Bhilai, and all my dedicated faculty of PG College of Nursing, and all my cheerful esteemed participants from various esteemed colleges across the state of Chhattisgarh, that is from north, south, east, and western. We are really happy and blessed to have you all here in this common platform of this conference hall to have a talk of the town, that is Madam Anu said today morning, that is to know about the competency-based nursing education, which is main thing that is will be coming to know about the simulation and OSCE in detail within this first 3 days of program, followed by many other competency what a nurse educator must know we have planned. So coming to my first, that we are really immensely grateful for the esteemed privilege of your presence at our workshop. Your presence has not only enriched our workshop but also profoundly impacted each one of us, instilling in us a renewed sense of purpose and determination. So thank you each one of you, all of the dear most respected lovable dignitaries, for joining us today. Your presence at the workshop added an immense value and depth to our discussions. We appreciate your thoughtfulness, contributions, and insight will be useful to improve lot of good sense in terms of simulation as well as these OSCE technologies, and that is the need of the hour. Coming to my first point, that is what is the essential behind this competency-based training program, why it is required for the nurse educators. Because this today morning we have listened, this competence-based nursing program is the need of the hour. Because as you know that our ever-evolving dynamic healthcare professions, that's what nurses have to if our forthcoming generation need much more skills. Previously, what we have done as a traditional method, we focus on only method of discussions and assignments and book reading that are gone. We have to focus now. That is what we have to say. They focus on this competency-based nursing education, which have lot of advantages over traditional methods. That is what? Bringing out what? Mastery of what? Mastery of skills. That is what? We are enforcing on measurable outcomes. And here in competency-based nursing education, it focused what? It focused only students what they must do rather than what they must know. So it is here in this competency-based education we will be skilling you with hands-on skill practice with lot of interactive discussions. Thereby I would request all of our participants, you all have to involve. As much as you involve, don't think that just for 3 days you forget your position and whatever. Just think that I am a student here, I must learn. So that attitude, that mindset, it will help you as much as you involve. Whether it is a small procedure or it is a big procedure. Morning you have seen pulse, which are very small procedure. And we never think that इसको हमको बहुत ज़्यादा attention देना है. But thing is that demonstration has opened a big difference in our way of doing the things in the classroom as well as in the laboratories. Yes? Yes? Yes. Your voice must have to reach to the trainers. That's why whenever whoever is taking, you involve, you interact, and if you have to say something, but you have to say. Don't hesitate to express yourself. So that is a gateway to open yourself and to add your skills. So that is what for each and every learners, as a passionate educators, nurse educators, you must have the ability to have this. And this competence-based nursing program, it improves the skills of the students, and that is what it have a consistency in our performance. That is why it has a big difference in the student assessment, in the individualized students learning, what Madam said in the morning. Yes? So that is what it will help to master over the skills. That way we can able to progress in a professional career, professional growth as well as professional development. Yes or no? And that is what this competency-based nursing education, it is already has been revised as per Indian Nursing Council syllabus. Each nurse educator must learn and must practice. That is what, unless until you learn, how will you able to practice with your student each and every classes. That is the only way we can bring the student skills within this. So that is what this conference, this 6-day training program, all the credits I used to give to Madam Dr. Bhilai, who has performed as desired, like her designation as a workshop facilitator, by facilitating all the 3 important areas, that is Indian Nursing Council, NRSA, SDT University, JAPIGO, and University, our Pandit Dindayal Health Science University, as well as our State Nursing Council and Dr. Kunjam Madam, by making them together, facilitating all the supports. That's what we are discussing. When you go to the NRSA, Indian Nursing Council has given you a chance to visit there to see the world-class facilities, where you can see everything. That itself it will motivate you to learn. And that is what, but thing is that we cannot bring everything over here. So I told the credits goes when we manage the thing within the available resources. Yes or no? And that is why we are very much enthusiastic in terms of learning the best skills from both of them who are master trainer in the particular field. And we are really very proud of you, and we all, on behalf of whole nursing fraternity, we welcome you once again to this session, and hope this 6-day training program will be very successful in terms of creating a meaningful insights, enriching lot of experiences, and having a everlasting connections and everlasting impressions about simulations, so that after that you will never say that you will have that attitude that tomorrow onwards I must start in my college, which is not required to have many big things, many big models, many big simulation facilities, nothing like that. You can start with whatever you are having in your mind and what you are having in your laboratories. So for everything, things will be easy when you think. So when you wish, things will happen. Yes, one day when I went for the training in NRC, SCT University, Gurgaon, that time at the end of the day, Madam has given an action plan. There I have written key, I have to do. So this is what, this has come as a, that my dream has come true today. And that time itself I thought I'll invite those faculties over to my college so that I can expose to whole Chhattisgarh, and you are the representative of whole Chhattisgarh nursing faculties, and along with Madam Kunjam. Yes? So we are really happy to have you all, and that is what is a blessing for us, that you are the sweet participants, ever dynamic, and you are keen for your students, and you are devoted, you are dedicated, and you are sincere, and you are having the attitude to learn. That will make surely a big difference in the state of Chhattisgarh. And also I used to say that Madam Kunjam is also, and our registrar sir of university, we, apart from these things and our support, their dedication, their support, their contribution, we can really appreciate them for each and every purpose of our nursing issues, events, they are there with us. Yes or no? In terms of our Dr. Rajesh Sikar sir, who registered in charge Pandit Jindal Health Science University, who I can give a great salute to you, sir, for regularizing our examination pattern, implementing this new syllabus, and giving us the result in time so that we can have our good admissions in the proper time. Yes or no? So all credit goes to sir, and all credit goes to Madam Kunjam, being a very young host, dynamic leader, igniting every one of us a source of inspiration. Yes or no? She is standing with us to all the colleges in all the happiest moments as well as in all the odd moments. So that's a great credit to her, and you keep it up, madam. We all the whole nursing fraternity are with you. And coming to my Surendra Gupta sir, I have no words to. Well, there is no words here. There is so thousands of words also will be less for this personality who is always there from the beginning, including to our most honorable chairman sir, Shri Vijay Kumar Gupta ji, and our secretary Shri Surendra Kumar Gupta ji, who are always there with us. कभी भी कुछ भी बोलो, just you proceed. मैंने sometimes I don't ask, I proceed, I finish, I inform them. So that's the way they are. So their heart is so broad. मतलब they are always in giving. Not taking anything from us. Always they are in the mood of giving till today. So we are really always feel blessed that I always say that my Bhilai education trustees are ऐसा कोई मिलेगा नहीं सर. मतलब ऐसा मैं so I feel so much of blessed. Even my faculties are full blessed with your kind support, contribution, advice, suggestions, instructions, whatever is required for us. You always support us. So a big hands up to you all, sir, for this movement. For a small kavita I have written on this competency-based nursing education. Let us cherish it before you could conclude this keynote address. In competency-based education, nurses gain proficiency, teaching skills tailored to each learner's efficiency. With goals clear and aligned, they guide the way, creating competent nurses day by day. Nursing teachers skilled in the art, craft competency need to impact each lesson learned, each skill acquired. With competency-based education, success is inspired. Competency-based education, the nursing teachers create, building skills and knowledge, fulfilling every need. With they refine, guiding future nurses to shape and shine. In the realm of nursing, where skills are key, competency-based education sets learner free. That is what individualized learning. Teachers empower with knowledge profound, making competent nurses forever renowned. With competency-based education, the journey begins. Nursing teachers shape futures where excellence wins. Through practice and assessment, each skill is refined, creating mind. That's what you have to do with your heart, mind. with competency as our guiding star, nursing teachers sets us near and far. From classroom to clinic, they instill competency in nursing, a lifelong skill. So that is what life is better when you are happy, and life is best when others are happy because of you. So this is a great moment, and let us cherish for each other and feel happy that we are here to learn from each other. Not that we are going to teach, not that you are single, you are here to learn. We are learning from each other. That's what I hope. These successful 6 days workshop with a resounding success, marked with lot of meaningful insights, enriching with lot of knowledge, as well as hands-on practice skills, and with the everlasting impressions. मैं एक चीज बोलना भूल गई. That is what in the competency or the simulation practice, what you do usually in the traditional method, what you do for the student in terms of demonstrating, just you teach the theory and concept, then you take to them to the laboratories. After laboratory, you send where? Clinic. So they are missing 2 things there. What? When they go to clinic, they will find their doctors will be there, junior nurses will be there, senior nurses will be there, and ward in charges will be there. This scenario they are missing in the laboratory. Are there anybody else like this? No. So when they go from this from the laboratory to the clinical setup, they found these are the difference. So what they have? They will feeling of hesitation. They will lack of confidence because teamwork means is the come home. So that is what we are introducing here in the simulation. You have to tell them to practice in the group. And when they are practicing, this is the way Madam Anu is demonstrating regarding pulse. Each student's involvement is there. That's why each student will have a मेरे को क्या करना है. देखो कल से मैं इनको बोल दी कि कल तुम लोग का ऐसे हमारा जो मास्टर ट्रेनर है वो बहुत सारा चीज प्रिपेयर करके ले आए. जबकि अभी इतना चीज अभी आज के लिए नहीं है. मतलब वो itself ignite with them कि मुझे चीजों में तैयारी करके रखना है. That means मेरे को क्या करना है, एक स्टेप के बाद मेरे को क्या करना है, एक स्टेप बाद नेक्स्ट. That's why they have that critical thinking. मुझे ये चीज और क्योंकि ना I am going to demonstrate to the big teachers है ना, nursing faculty who are very senior and उनके सामने मुझे कुछ बोलना है तो I have to prepare fully. In that way they have prepared. That means they are utilizing the critical thinking. So each one will generate their critical thinking before they could step anything for the patient care. So that is what in this simulation technique we are utilizing, including these 2 things. One is performance in the group, and second is giving a time for them to have a critical thinking for the patient care. That is what competence-based nursing program it is, developing a mastery on skills, patient care, communication, collaboration, and professional growth and development. So have a very good day ahead and have a very bright, and I hope that these all things arrangements are done. It is big enhancing our look. You will be telecasted through YouTube. So it is another. It has also added other wing for all of us in today's occasion, and hope that this you will enjoy and take back with lot of memorable events which will be utilized in your day-to-day practice with the student interaction and developing the skill, so that we can prepare our future generation in the ever-evolving dynamic healthcare field. So thank you. God bless you all, and Jai Hind, Jai Bharat, Jai Chhattisgarh. Thank you all.
Thank you, ma'am. Today, one of the biggest challenges that we face is the lack of skills in degree students. So how do we develop skills? There lies the concept of simulation. We work and practice with lifelike environment and cases. This gives us a platform for honing our skills and prioritize our moments and make us efficiency laser-like, so that no room for error and misjudgment becomes less and less. In this regard, it is with great pleasure that I introduce Mr. Linto Andrews, Advisor Nursing and Midwifery at Japaigo, our distinguished guest speaker for today's workshop at our esteemed nursing college. Mr. Andrews brings a wealth of experience experience and expertise in the realms of nursing, public health and program management. With a master's degree in community health nursing from Yenepoa University, Bangalore, and extensive training as a master trainer through Japaigo, an affiliate of Johns Hopkins University, he stands as a beacon of knowledge and innovation in the field. Throughout his career, Mr. Linto has demonstrated a profound commitment to improving healthcare systems and advocating for policy changes to enhance patient outcomes. His tenure as an advisor and senior program officer at Japaigo highlights his prowess in policy advocacy, government licensing, and program management. Moreover, his roles in simulation-based training at National Reference Simulation Center underscore his dedication to advancing nursing education and enhancing the skills of healthcare professionals. Notably, Mr. Andrews has played pivotal roles in various initiatives supported by esteemed organizations such as BMGF, that is Bill and Melinda Gates Foundation, and the DFID, that is Department for International Development. His contributions in strengthening nursing and midwifery education in India, particularly in Uttar Pradesh, reflect his passion for capacity building and skill enhancement within the healthcare workforce. As we delve in today's workshop, we are fortunate to have Mr. Linto Andrews grace us with his presence and share his valuable insights and experiences. Please join me in extending a warm welcome to Mr. Linto Andrews, whose expertise promises us to enrich our learning journey and inspire us towards excellence in nursing and public health. I request Sir to address the session on evaluation of nursing trends and policy shifts in global and Indian context.
Respected all the participants. For the address, I am taking a little bit unusual thing. I have a small PowerPoint presentation. Since I thought we have most of the people from the state, the decision makers from the state, especially for the nursing, we have registrar from the nursing council, and all of you are the senior faculties, and most of you are the principals of the nursing institutions across Chhattisgarh. So I thought this small presentation will be helpful to some of the decisions going forward for making some of the changes in the nursing fraternity in Chhattisgarh. So I will be briefly telling you about the global perspective, what is happening around across the globe on nursing, and what is the recent changes in India. I hope this slide is visible to it. Can anyone confirm it's not visible? Is that fine? Visible? Yes or no? Small. Okay, no need to read all the lines. At least you can see the picture. I will explain what I have written in this slide. So, in 2020, we have the first State of the World Nursing Report, which is released by WHO and ICN, and Japan was the official partner to prepare this report. So, what is the importance of the report? As I said, this is the first time in history the World Health Organization has released a report exclusively for nursing. So, we have a State of the World Nursing Report in 2020, and followed by we have a State of the Midwifery Report. Again, it's from WHO and ICM, International Conference for Midwifery, and we have a state of the Global Strategic Direction for Nursing and Midwifery. So the 74th World Health has released this strategic direction for nursing and midwifery. You need to understand what is. Everybody knows what is World Health Assembly, right? So all the member states, almost 195 member state people will join all together in Geneva every year in the month of May. So we will have a participation from India, like we will have a health minister, we have from the central government, we will have the health minister and we will have the health secretary. Of all the 195 member states of WHO will all together and they will take the health related decision. So in that assembly, in 74th World Health Assembly, they have passed this resolution. It's called Strategic Direction for Nursing and Midwifery. And if you look at all the three reports, so what is the content of these reports? And everybody, I hope some of you have gone through, or if everybody have gone through this report, well and good. Can you raise your hand? How many of you have seen these reports and its recommendations? One? Just one. Among 50 people, only one of you have seen the report.
Recently, I with the residents from my Indian Nursing Council at Nagpur, they taking it out. I have not seen what's needed, but I have here to some extent.
Sure. So I have kept this session for Dr. Bhilai only since he was not available for today, so I thought I will take this session. So just move to the next slide. So if you look at these recommendations, what these reports are talking about? It's talking about data. It's talking about the health workforce data. Especially if you look at the nursing report, it talk about the nurses data who is actually working in the country and in the global context. And it also talk about the evidence-based policies. It also gives some evidence recommendations for policy changes, which is again evidence-based. And also it's talk about the investment. We need more investment to strengthen the healthcare workforce, especially nurses to achieve the universal health coverage and health-related sustainable development. And also if you look at all the three reports, why I am always quoting three reports, the recommendations are almost similar in the three reports. Especially it talk about investment. It talk about investment in the nursing leadership. It talk about investment in the nursing education. It talk about investment in the nursing jobs and services. So if you go, so these are the main four buckets given in the reports. There are several more recommendations inside these four main headings. I request all of you to go through these reports and at least through the recommendations. All these reports are available in the public domain. If you just simply Google it, you will get all the three reports. Just next slide, please. And the State of the World Nursing Report, which has given a theory of change. What the theory of change suggests? It suggests we should have a broad engagement. I think in our institutional level, we might be doing this without understanding the theory or the theory of the change, maybe with understanding, without understanding, whatever it may be. But what the theory suggests, we should have a broad engagement. Madam Friedel and the principal madam said the same thing. So they had a small engagement with the nursing council and with the registrar. So they discussed the health workforce account, competent data violated by the country. So basically they talk about you are here to discuss the data and current status. So especially in this context, what I am giving the example, she talk about the training part, the competency of the staff, the faculty, whatever we have in Chhattisgarh. And they have a policy dialogue. So they had a dialogue with the council or dialogue with the registrar to have the more investment. That's how they got this investment and that's happening today here. So if you look at the theory of change, it's just about the broad engagement, it's talk about the data. So if you look at the India perspective, do we have a data of nurses actually working on ground? Do we have a data of nurses, the total data of nurses who is working in the Chhattisgarh, especially the government, and do we have a live register? So it's talk about the data. So if you look at the WHO, they have given a national health workforce account. We need to update every year that health workforce account. Everybody, like all the member states, have to update every year. And from that account, they have released this, the first State of the World Nursing Report, the first report. But whatever data from Indian context we have shared is that accurate, is the correct data. It's not actually. Why? Because we don't have a job register as of now. Indian Nursing Council has taken that initiative in 2015-16, but still we have not achieved the 100% saturation on that. So let's talk about the data. So that's the primary thing we should have. We should have an actual data of health workforce. And let's talk about the dialogue. We need to have a dialogue with continuous dialogue. It's not a one dialogue or two dialogue. We should have a continuous dialogue with the policy decision makers. So we need to identify who is the decision maker for us. We need to identify in your institution who is your decision maker. We need to identify in your region. We need to identify in your state who is the decision maker. So we need to identify the decision maker first, then we should have a continuous dialogue. The report itself suggests we should have a continuous dialogue because most of the times when we interact with the people in the state, they say we did try a couple of times, but it's not moving, it's not happening. But the report suggests we need to have a continuous dialogue till you achieve. So continuous policy dialogue. And how you do the policy dialogue? So when you do the policy dialogue, we should have an evidence. Evidence for the policy dialogue. We should have some data in our hand. How you convince the policy people, how you convince the decision maker. We should have some data to talk. If you talk something like without any basic, without any evidence, without any data, nobody will be convinced. So we should have that evidence in hand. Then the investment happens. Right? So this is the policy theory of change. This is suggested by this report. Move next. And also, as I said, the first report which is released in 2020. And the recent ICN conference which happened in Canada, the WHO director he has announced the WHO is coming up with the second stage of the World Nursing Report, and which will be released in 2025. So these are the things happening. There are several more things, but I'm just focusing on this global report which is focusing on the nursing and midwifery recently. So another second report is coming by 2020. Next slide. And if you look at the national level, what are the changes happening? Everybody aware, we have National and Nursing Midwifery Convention Act, which is passed. Now it will be repealed by the Indian Nursing Council, so the NMC will be in place. The government is already in the action, so that will come soon. It's already happening. Next slide. I'm not going to detailing all these things because it's all aware, but I just want to give mind so that you can think all of these things for the Chhattisgarh context. And as I said, the National Nurses Registration and Tracking System. So if you look at the current status, you can see in live like how many is registered. So it's talk about the total enrollment is around 11 lakh nurses are total enrollment. Then out of that around 11 lakhs we have identified, they verified. Then around 9 lakhs nurses it's approved. The NRPS is approved for 9 lakhs. So it's talk about across like all the state, entire India. So do we have only this many nurses in the country?
No.
11 lakhs. So that's giving the status. So we need to improve this data. Like how we can improve, how we can support the national government to improve this, because until unless if you don't have a data in hand, we cannot make a proper decision at the national level for the nurses and midwifery especially. And if you understand one more thing, across the health workforce, we have nurses, we have doctors, we have dental, we have Ayush. Across all these domains, only we have one live register only for nurses, and which was started in 2016, and still we are struggling with to complete it, get it 100% saturation. Next slide, please. So we have another initiative. So as I said, in the global recommendations, it talk about data, it talk about investment in education, jobs, service delivery, and the nursing leadership. If you look at the jobs, it's again the recommendation saying that we should have more practitioner programs, nurse practitioner programs. Currently, how many nurse practitioner programs we have? We have NBCC in place. And recently in 2018, Government of India has initiated for starting the nurse practitioner in midwifery. It is going on. Again, Japan will supporting for the same. And the ministry and the Government of India has committed to have around 86,000 post creation for nurse practitioners in midwifery. I'm not sure about the timeline, but there is a commit from the government. They will create a post for nurse practitioner in midwifery around 86,000. But do we really have a position for nurse practitioner in critical care? So that's the one of the reasons we are not able to have the people to accept or come forward for this practitioner program. But this advocacy is happening at the national level, but we should have the same advocacy at the state level also to convince our people to create more position for practitioners. Because again, the government is in planning to come up with a 10 more practitioner programs following the recommendations of this global recommendation. Can we move forward? Next. Yeah, so this is another one. Chepai was supported another nursing campaign. This is a national campaign we did in 2021-2022 along with the support from Indian Nursing Council, Trained Nursing Association of India, Society of Midwives. So we have did this campaign to create a sense among all the public, because if you remember in 2019 and 2020, like during the COVID pandemic, like most of the days we are having the newses in the social media, newspapers, they talk about the contribution of nurses, right? We have seen that than any other health professionals, every day there is a highlight for a nurse like doing a wonderful job. So we thought of continuing that momentum for some more time through this campaign, so that we can have an advocacy, side by advocacy with the government to achieve some of the asks, whatever we are. So that's the reason we initiated this 1 year campaign, national campaign, following the international campaign. If you are aware of international campaign, Nursing Now campaign. You heard about the Nursing Now campaign? So, right? So again, Indian Nursing Council was supporting for that international campaign. So following the same, we did a national campaign here called Nurse Midwife for Change. Next slide. So this was some of the objectives to improve the public image of nurses and midwives, and also to gather some of the highest political support to move the nursing and midwifery agenda. And if you look at the overall changes at the national level, if you look at, and you need to match with the global recommendations. If you see, we have 3 key nursing positions filled at the national level by Government of India, which was vacant for almost 10 years, almost a decade, more than a decade. After Dr. Bhilai, like, who was the advisor for Government of India, then the last year we have Dr. Deepika. She has joined as an advisor. We have an ADG joined. We have an additional director joined. So we have 3 positions filled in the national government as of now, and we are planning for more positions. And we have a commission, the NNMC bill, NNMC Act, which is in place. If you look at the INC Act, 1947 Act, it has only can deal with only the education, nursing education, not with the practice. But with the new commission, we can have a scope for both the nursing education and nursing practice. So that's a new scope, and we will see in like going forward in future how it is going to impact and how it will be helping us. And again, the recent union budget, they announced 157 new nursing institutions which will be established in various states in the district headquarters along with the medical college. So that's again investment in the nursing education. So government is already doing it. It's happening in some of the states as well, but from the government, the national government, they have budgeted the amount for 157 new nursing colleges. And as I said, there are 10 more nurse practitioner programs coming up. The ministry is drafting a guideline for improving the working conditions for nurses. And also, like, the ministry is investing in the Delhi, like in RIT College of Nursing, to establish a center of excellence. And also, I have a few updates on the states, because I'm working closely with some of the states. If you look at the Northeast, the nursing directorate is approved by the cabinet. So soon they are going to have a separate nursing directorate in Mizoram. In many states, it's files, like they have placed the files in the various levels for the policy decision makers. But Mizoram has achieved, especially in Goa, they are very positive. We had a discussion with the health minister also there. So they are very positive. So If you look back to the recommendation, it was saying investment in the nursing leadership. So do we have a nursing directorate in every state? We don't have it in most of the states. So we need to move forward with that. So what's the status in Chhattisgarh? How we can do that? Because for managing the entire nursing fraternity, because if you look at the health workforce, around 60 to 70% are the nurses. So we need a proper nursing directorate to manage the entire nursing fraternity for the proper management of the care. If you look at Goa, I said Madhya Pradesh, Bhopal, our nearby districts, they are investing around 23 crores to establish a center of excellence in Bhopal itself. I think that's already in place, it's going on. Recently I heard they have called the tender for the building. Then if you look at Uttar Pradesh, most of you might be aware about Mission Nirmay. So the Chief Minister has taken an initiative to reform, 360 reform of the nursing card. So they are working for the service, they are working in the nursing council. So that's the one state we don't have a separate nursing council. It's all combined together. So again, what they are working on it. So some of the policy changes, so many things are happening in the QCA is doing the rating of the institutions. One level they have done it. Might be most of you are aware about, maybe some of you will be part of those assessments. So that's happening in Mission Nirmay and Uttar Pradesh. If you look at Kerala, the recent 3 days back, I have seen they have budgeted five new nursing institutions in the public sector. So again, investing in the nursing education, they are. And if you look at the Bihar, Parivartan, the new program, again Japan was supporting them through the DHF support, Mission Parivartan. Again, it's for the reforms of the nursing card in Bihar. And if you look at Northeast states, the World Bank investment in the Northeast states, Mizoram, Meghalaya, Assam. In Assam, we are supporting them for the again the reform in the nursing card. So all these states. So now the situation is very positive. People are really aware about it. Our Prime Minister, he himself is very positive towards the improving the nursing fraternity, and following that, most of the government officials, government in the states, they are coming forward. So this is the right time. So we need to, but the thing is, we need to have a right people, we need to have a right advocacy, we need to ask for the right thing. So that we need to identify among ourselves, and we should have that advocacy forward. Next slide. That's it from my side. Thank you so much. But here, if you remember, we have taken a session in the morning, how to teach a skill. It's a very simple step, right? So just think about this thing, in the global and the Indian context. Do we have a common checklist for entire procedures available in Chhattisgarh? No. Do we have? No. So what is your plan? So we need to think, we need high fidelity simulation lab in Chhattisgarh. We should start a proper checklist for, do we have a OSCE? Because what the madam said, we should have a consistency in the teaching. If you don't have a common template, if you don't have a common checklist, how do you maintain that consistency? How do you maintain there will be some friction when you go there. No, how am I seeing it? It's little different, right? So do we really think about our registrar madam is here, registrar from the university is here, and most of you are the institution heads. So we should think about. So this is one point to think about. So there are many more. So I will stop here. Thank you so much for inviting me here for this session. It's wonderful meeting all of you. I would like to thank Principal Madam Bhilai and Madam Srilega for giving me this opportunity to interact with all of you. Wishing you all the best, and I will be here for till Wednesday morning. We will have some more very good conversation. Thank you so much.
with various policies, norms and programs. Our honorable guest, esteemed faculty members from various institutions and my dear colleagues, it gives me great pleasure to introduce our distinguished chief guest for today's workshop at our college, Dr. Rajesh Rishikar, Registrar and Examination Controller, Pandit Deendayal Upadhyay Memorial Health Science and Ayush University, Library. Dr. Rajesh Rishikar brings with him a wealth of experience and expertise in the field of medicine and medical education. With an MBBS and MD in pharmacology, he has dedicated his career to both clinical practice and academia, shaping the future of healthcare professionals through his administrative roles. Over the career, Dr. Rishikar has held several key administrative positions in for an from 2000 and vision have played a pivotal role in shaping medical education policies and fostering excellence in healthcare institutions. During his tenure as principal of Government Dental College and later as a professor of pharmacology at Pandit J. Medical College, Raipur, and late Bali Ram Kashyap Memorial Government College, Jagdalpur, Sir demonstrated his commitment to academic excellence and student welfare. His dedication to nurturing the next generation as Registrar and Examination Controller at Pandit Deendayal Upadhyay Memorial Health Science and Ayush University, Raipur since 2019. Sir continues to contribute significantly to the field of medical education and administration, ensuring the highest standards of excellence and integrity. As our chief guest today, Dr. Rajesh Rishikar's vast experience and profound insights will undoubtedly enrich our workshop discussions and inspire us to strive for education and practice. His initiative in bringing this skill-based training to our college will give that to all the participants. Please join me in extending a warm us and promise us to elevate our learning experiences. I humbly request Sir to address the gathering.
Respected dignitaries, once I was looking at the slides shown to us and nursing in the state, I feel the urge to talk something about the conditions of nursing because I am on the other side of the board. I usually prepare the results and I used to see that there are institutions having very poor results in the examination. What is the cause behind that? What is lacking exactly in the teaching process? That we have to realize, we have to adopt, and that's why before reorientation, I feel the orientation of the teaching of nursing is important for us, so that we should have the thing what the students want to learn, because I suppose I am the person who is privileged to teach all the faculties of medical education. I taught medical colleges, in dental colleges, in the nursing college, and even in the Ayurvedic and pharmacy. So the standard of learning in each category is different, and that's why you have to adopt accordingly to their level to learn the things. And that's why you might have seen that a poor student is a good teacher, because he knows what are the lackings, what are the things which we usually don't learn from a good learned person. Because what happens if the student is very good, he can't be a very good teacher, because he feels that he knows, or the students may be knowing everything, whatever I am knowing. That's why before reorientation, I feel that the orientation regarding the teaching method and methodology. and methodology is more important. Anyway, I am not the person to comment on this, but because the science is rapidly changing and with the introduction of artificial intelligence, it is very important that we should have in progress with the other states of the nursing teaching with our state, because I feel that our state is still lagging behind in many aspects of nursing, teaching, nursing, education. Anyway, here are the learned people to teach you, to tell you something, and everyone was talking about our ancient words. I will talk about something about the knowledge, learning, and method of learning. So, what we know that knowledge in broad sense, and in no sense we can call it as Gyan. Gyan, you are here to receive the Gyan, and a Sanskrit proverb is there, na chori haram, it can't be stolen. Nahi bhatra bhagyam, it can't be divided with the brothers. Na chori haram, nahi bhatra bhagyam, na rajya haryam, it doesn't need any income tax or any GST.
Yes.
Na chori haram, nahi bhatra bhagyam, na rajya haryam, na cha bharakari. It is not a burden like other assets, other monetary assets or other gains you have. Na chori haram, nahi bhatra bhagyam, na rajya haryam, na cha bharakari. The most important is vyaye krite vardhate vanityam. If you spend it more and more, you will receive more and more. And that's why vyaye krite vardhate vanityam jnanam dhanam sarvadhana pradhanam. It is the most important treasure which you are going to listen from the learned people. Thank you very much. And thank you for inviting me over here. Thank you very much. Thank you.
As a token of appreciation, we would like to release this souvenir to commemorate this special occasion. In this regard, I request our Chief Guest, Dr. Rajesh Shishikar, and the guest to release the souvenir.
Thank you for all the contributors and designer architecture for the same. I think you will be reading and enjoying.
Thank you.
Thank you, sir.
Thank you, sir. How do we show honor to people who are already in high honor in our heart? It is but a small token of appreciation and gratitude for all that they have been. I request our secretary, the principal madam, the district ma'am, to please honor our chief guest with a moment.
I'm sorry that I had to leave over there because, as you know, that this timetable for the examination has been already scheduled.
हमारे साथ दो लाइन आपके वाले में दो
The great journey begins with the first step. I request our Honorable Secretary, Bhilai Division Trust, Shri Surendra Gupta sir, to address the gathering.
हमने मत पढ़ा था वहाँ पर से पढ़ देता हूँ सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखात् अर्थ है हे नाथ सब सुखी हो कोई ना हो दुखारी सब हो निरोग भगवान, धन धान्य के भंडारी, सर्वत्र भाव देखे, सन्मार्ग के पथिक हो, दुखिया न कोई होए, सृष्टि में प्राण लाए। तो हम लोग इस भावना से जो है, कोई दुखी ना हो, सब सुखी। ये बड़ा गर्व का विषय है। आज हम सेमिनार कर रहे हैं और इसके लिए मैं रजिस्ट्रार सर डॉक्टर राजेश शिखर जी, रजिस्ट्रार दीनदयाल उपाध्याय यूनिवर्सिटी, उनको बहुत बहुत धन्यवाद दूंगा मैं। इनके कारण ही प्रोग्राम हुआ है, उनके ना तो ये प्रोग्राम का छत्तीसगढ़ लेवल पर होना मुश्किल है, क्योंकि अब पहली बार आए हैं, ऐसा इंफ्रास्ट्रक्चर वहाँ देखा होगा। We are the oldest college in this city. We were not only in the central India. In 86, there was no concept of the BSc nursing. Only 20 government colleges there and few.
MP level. So that too in MP level.
MP level.
No college in Chhattisgarh when this was established.
No. तो we are सबसे लोग कर रहे हैं और जैसे लाइक छत्तीसगढ़ में बहुत लेवल कम है, लेकिन बताना चाहूँगा मैं, हमारे यहाँ का टीचर्स जो हैं यहीं के पढ़ाए हुए कभी छत्तीसगढ़ में प्रिंसिपल में आपके किसी के स्टाफ में
छत्तीसगढ़ हो गई
Not Chhattisgarh, not only Chhattisgarh, in MP also.
दूसरा मैं रजिस्ट्रार मैडम इस कुंजुम को जो है धन्यवाद दूंगा, जिनके सपोर्ट की वजह से हो पाया। और सबसे जो है इंडियन नर्सिंग काउंसिल के दिलीप कुमार, जब 2011 में यहाँ पे आए थे, उसमें उन्होंने मेरे को कहा कि आप सिमुलेशन लैब एस्टैब्लिश करें, और तभी से हम लोग मेरे कोशिश में सिमुलेशन के लिए जो है, और IMI आफ्टर करिए कभी, लेकिन अब आज आकर के समय मिला है कि हम लोग सिमुलेशन पे वर्कशॉप कर रहे हैं, और इसके लिए उन्होंने हमारे 2 ट्रेनर लेटू एंड्रूज को, मैडम अनु को जो है यहाँ से भेजा है, क्योंकि अपने एक्सपर्ट मेडिकल लेवल के एक्सपर्ट से वहाँ हैं, इसके लिए आपने स्पॉन्सर किया। तो हम चाहेंगे कि इस तरह के वर्कशॉप जो होते रहें और यहाँ पर भी हम इस्टेब्लिश करें। मैंने कहा मैं कहीं देखिए क्या क्या है प्रोजेक्ट और सोल्यूशन का मुझे इस्टेब्लिश करना है, ठीक है, यहाँ पर क्योंकि इतना हमने OT बनाया हुआ, ICU बनाया हुआ है, ये भी बना सकते हैं। साथ में मैं ये देख रहा था, मॉडल लगाया थोड़ा सा ये लर्निंग सर्कल, तो मैं तो वही थोड़ा सा आउट टू इंजीनियरिंग वाला हूँ, तो इंजीनियरिंग एंगल से चीज़ों को देखता हूँ मैं। PDCA साइकिल जो है उसमें देखा नॉलेज, पहले होता है नॉलेज, देन द क्या स्किल प्रोफिशिएंसी पहले आ गया है, ठीक है, एंड डिसीजन मेकिंग उसके बाद में है सिमुलेशन और एक्सपर्ट का जमाना है। तो इसको जो है मैं वेदों के अनुसार लिखता हूँ, ऋग्वेद, यजुर्वेद, सामवेद, अथर्ववेद, इस सीक्वेंस में है। ऋग्वेद ज्ञान का, यजुर्वेद कर्म का, सामवेद उपासना, अथर्ववेद विज्ञान। तो इस सीक्वेंस में तो प्रैक्टिस में ज्ञान हमने ले लिया, उसके बाद कर्म करना है, स्किल प्रोफिशिएंसी, स्किल के बाद में सामवेद उपासना और प्रैक्टिस, जिसे नहीं आते सब प्रैक्टिस, एक्सपर्ट बनने के लिए प्रैक्टिस करना है। सिमुलेशन वही चीज है कि आप प्रैक्टिस जितना प्रैक्टिस करेंगे तभी एक्सपर्टाइज करेंगे, तो वी हैव टू अचीव टू एक्सपर्ट। तो हम लोग का टारगेट ये होना चाहिए, और मैं खुशी है हमारे टीचर जो है स्टाफ में लगा हुआ है, और नेशनल लेवल पर जो इंस्ट्रक्शन होते रहता है। और हमारे यहाँ वो 30 साल पुराना, 25 साल 30 साल पुराना जो यहाँ पढ़ा और यही का हो गया ऐसे भी स्टाफ है। इस सब प्रोग्राम में धन्यवाद दे रहा है हम लोग अभी उन्हें ग्राम देता हूँ। ओम शांति।
Thank you, sir. The nursing profession demands compassion, integrity, and selfless spirit. Now it's our pleasure to request our special guest, Mrs. Durgavati Kunjam, Registrar Chhattisgarh Nurses Registration Council, Raipur, to address the gathering.
Then Dr. Visiting sir, Gupta sir, Principal Madam, Vice Principal Madam, Anu Madam, sir का नाम भूल गई, sorry. एवं सभी सहभागी, आज का जो वर्कशॉप है वो हमारे लिए और पेशेंट के लिए बहुत ही फायदेमंद है। तो हम यहाँ पे ज्ञान लेने आए हैं और देने भी आए हैं। सर ने कहा न चाहे हारा न भाग्य भाग्य, मतलब ज्ञान को ना कोई चोरी कर सकता है ना उसका विभाजन हो सकता है। हम जितना बांटेंगे उतना वो हमारे साथ बढ़ेगा, है ना। तो यही उन्होंने कहा, सही बात है। जो हम सीख के यहाँ से जाएंगे वो हम अपने स्टूडेंट को सिखाएंगे और वो अप्लाई करेंगे पेशेंट के ऊपर, तो उनको फायदा होगा और इसके साथ हमें भी बहुत कुछ सीखने मिलेगा। मैं ज़्यादा कुछ नहीं कहूँगी। सर के साथ साथ सर का जैसे एग्ज़ाम का कार्यक्रम, एग्ज़ाम का काम है, वैसे ही मेरे यहाँ GNM का एग्ज़ाम होती है, तो मैं एग्ज़ाम कंट्रोलर होने के नाते मुझे भी थोड़ा सा काम है। बस थोड़ा सा कहूँगी। Competency based training for nurses educators. I extend my warm greeting to you and the entire faculty of the PG College of Nursing. It is with great pleasure and anticipation I acknowledge the initiative taken by your esteemed institution in organization the competency-based training program for nurses educators, sponsored by the Pandit Deen Dayal Upadhyay Memorial Science, Health Science and ICE University, Raipur. Such endeavors play a pivotal role in nursing excellence within the nursing profession and contribute significantly to the advancement of healthcare education. The competency-based training program reflects a commitment to continuous professional development and underscore the importance of equipping nurse educators with the necessary skill and knowledge to excel in their roles. I commend your decision to providing high-quality education and training opportunities that will empower educators to inspire and shape the next generation of nursing professionals. On behalf of the Chhattisgarh Nurses Registration Council, Raipur, I would like to express our appreciation for your commitment to excellence in nursing education and your provocative approach to enhancing the quality of nursing education in our region. We are working closely with our mission to promote standard of excellence in nursing education and practice, and we are confident that this program will have a positive impact on the training community.
I extend my best wishes for the success of competency-based training program for nurses educated and look forward to hearing about the meaningful contribution and achievement that emerge for this initiative. Thank you, Lord. Thank you.
Thank you, madam, for your motivating words. Now I request our principal and vice principal to honor our guests with mementos. I request our secretary, sir, Shri Surendra Gupta, sir. I request our Madam Sir to please honor our guest speakers with mementos. I request Mr. Linton Andrews and Mrs. Anu Grover. I request our principal to honor our secretary sir with mementos. Thank you, madam. Lastly, we would like to express our gratitude and appreciation for everyone's contribution to organize and conduct this workshop. In this regard, I would like to invite Professor Dr. Roja Presi to deliver the vote of thanks.
Gratitude is not only the greatest of virtues, but the parent of all the others. A warm and cherished morning to our distinguished guests, Dr. Rajesh Kishikar, Registrar in Charge, Pandit Bhilai Upadhyay Memorial and Health Sciences and Ayush University, Raipur. Mrs. Durgavati Kunjam, Registrar, CTRC. Mr. Lindo Andrews, Advisor, Nursing and Midwifery, Japayo. Mrs. Anu Grover, Program Director, NRSC, SGT University. Sri Surendra Gupta, Secretary BET. Dr. Professor Abhileka Biswal, Principal Workshop Coordinator. Dr. Professor Srilata Pillai, Vice Principal Workshop Facilitator, Resource Persons, and dear colleagues. It's my privilege to acknowledge and the support and contribution of each one of you and propose vote of thanks. First of all, I would like to extend sincere gratitude to Almighty God, with whose grace the inaugural session of this 6 days workshop was successful. On the behalf of the entire fraternity of PG College of Nursing, I would like to thank Dr. Rajesh Kishikar, Registrar in Charge, Pandit Bhilai Upadhyay Memorial Health Sciences and Ayush University, with whose wholehearted cooperation and support this intellectual feast became a reality. Thank you, sir, for adorning the occasion with your gracious presence. We are forever indebted to ex-Vice Chancellor and all executives for the extension of sponsorship and encouragement. Special thanks to Mrs. Durgavati Gunjam Madam, Registrar, CTNRC, for spending her busiest time gracing this occasion. Her presence and thoughtful words were an encouragement for us. Thank you very much, Madam. Special gratitude to Mr. Linda Andrews and Mrs. Anu Grover for extending your willingness to come all the way to give hands-on training on innovative method of teaching. I take opportunity to appreciate your sincere effort for improving the quality of nursing care. Special thanks to Sir for revealing the policies about in nursing and the need of registering in NRTS. I am glad to express words of gratitude to Sri Surendra Gupta, Secretary BET, for always being supportive for all college endeavors. Sir, thanks for your words of encouragement also. Our sincere gratitude to Dr. Professor Bhilai Biswal, Principal PG College of Nursing, cum workshop coordinator, who guide us in every moment and every step to make this workshop a successful one through her talent to create opportunity in every challenge. Thank you, Madam, for being the listener and the true leader. From the inception and throughout its successful execution, Dr. Professor Srilata Pillai, facilitator, played a significant role. She was the backbone, and with her dedicated and thoughtful act, we could excel in this workshop. This workshop won't be possible without these enthusiastic leaders who came from different parts of the state. This is a time to learn from each other. Hope you will enjoy this one-week-long feast of wisdom. I sincerely appreciate your dedication for the upliftment of nursing profession. Hope this will be a memorable event for you all. This type of a week-long workshop cannot happen overnight. The wheel started moving about few months ago. We have been fortunate to be supported by a team of very active and dedicated teaching faculties. Deepest gratitude to all for your willingness to complete tasks beyond your comfort zones. I also wish to thank non-teaching and supportive staffs and student leaders who work behind the scene to execute this event. Thank you very much. Thanks to all. Have a nice day.
Thank you, Roja. I would like all of you to please stand up for the national anthem.
तुमने बैटरी निकाल के लगा तुम्हें मैं आऊँगा तुम्हारे घर नाश्ता करवा के इसको हटाओ।
सेटअप और एक सीट डिस्प्ले। हाँ पहला भाग ये
Okay. Good noon to all of you, and hope you all are enjoying this journey of learning. And so in our first class, Madam Anu Grover demonstrated how we should use the checklist. As a teacher, how we should use the checklist for our students. And I hope you must have, thoda bahut you are acquainted with what steps we have to follow when we use the checklist. So now the next session we are going to have that same practice. How to use the checklist, we will be going in different labs, 5 labs are there, okay? So we have divided the participants into 5 groups. So let me call out the names. What you have to do there is that in one group you will have 8 participants and one of you will become a teacher and you have to do the same thing as it was demonstrated here, right? Okay? So we have 5 groups. So in group 1, we will be doing the skill of CPR. Okay? And Dr. G. Hemavati Madam will be there. So in group 1, we have Sister Molly Thomas. Yes. Prince Varghese. This is not. Sita Parvania. Then Neelam Paul. You all have not come. Okay, I hope all have reached. Somebody stepped up. Okay, what I was saying that we are going to divide all of you into 5 groups where we will be having the practice of using the checklist. Okay, how Madam Grover demonstrated here, the same way you have to demonstrate there. And one of you will become a teacher and you have to carry out the same steps. Okay, so in the first group, Sister Molly Thomas, Mrs. Neelam Paul, are you there? Yeah. Prince Varghese, Sita Parvania. Okay. Sita, you will be in group 1. Then Neha Purohit, Miss Neha Purohit. You can fit together. Then Sandhya Piyush and Sonia Dala. So you will be the first group and you will be going along with Dr. G. Hemavati. Okay? So you will be going to a fundamental lab where you will demonstrate the skill of CPR. The second group will remain here in the conference hall and you will be doing the skill of pulse, the same thing that was done here. So in this we have Dr. Sindhu Anil Menon, Shailaja, Dr. Shweta Sindhu, Mrs. Shabnam David, Alka, Chandrakala, Mr. Anurag John and Rahul George. I hope they are not there, they have not come. So you will be in one group and you will be guided by Bhilai madam. Okay? Then the third group we will be doing in anatomy lab and Shushila madam will be guiding you. Mrs. Mamta Shashi Sahu, Miss Ruth, Sister Binsi, Mrs. Swapnil Nihala, Mrs. Parvati Gajpal, Mrs. Lily Sani, Mrs. Elizabeth Masi and Miss Gitanjali Deshmukh. Okay, you be with them. That is, you will, Shushila madam will be taking you to the anatomy lab. Then the fourth group, we will have the skill in community lab. I will be guiding you. So we have Mrs. Chitra Rawani. Is she there? Mr. Daniel, Dr. P. Balakrishna, Ms. Lipika Joshi, Mr. Nilesh Masi, Mrs. Sri Rama Nair, Mrs. Leena Sahu and Mrs. Neha Sen. Okay? And
And the last group, Madam Anu Grover will be guiding you with IUCD. So in that group we have Miss Akansha, Miss Poonam Ikka, Mrs. Rachna Gadia, Mrs. Tripti Soni, Prabha Pandey, Mrs. Preeti Das, Mrs. Vinita Kashyap, and Mrs. Ashwati Pillai. So I hope you are clear with your groups. Okay? Any confusion? सबका नाम था ना मैंने जो read out किया. Okay. The people who will be guided by Abhilekha madam, that is Sindhu madam and group, please remain here. Okay? So the first group, that is Sister Maureen Thomas. Please, you can go to fundamental lab. Mrs. Neha Singh, please guide your group to community lab. And please take Mrs. Mamta Shashi madam and group to anatomy lab. And the last group, that is Miss Akansha and Poonam Rachna, Miss Tripti Soni, please go to the OBG lab. Right?
जा
अभी एक क्लास है उसके बाद होगा बोलते हैं तो रिटर्न वापस
बुला रहे
रुक जाओ 1 मिनट
नहीं जाना अभी यही कर रहे हैं
मैम अभी कोई क्लास है बोले
नहीं अभी कुछ भी नहीं है प्लीज गो बैक टू योर ग्रुप
कंफ्यूजन है यार
checking the radial pulse so that to see the what is the status of the pulse and any changes is there or not, I have to record. So please help me and support me in this procedure. Thank you.
So to make the patient comfortable, you can give a supine position to the patient or a sitting position. I have identified the patient and verified whether the patient is alpha or not, and because I have asked the name of the patient and also seen the case file and verified the patient is alpha. Then ask the problems, disease, what the symptoms is there, I have identified. Then next I will assemble on the tray. Tray is containing the tray with the bound having the box pieces. Then have to pound the pulse for 1 minute. It should not be very tightly or we should not put pressure on the so we have to touch and feel the pulse. In pulse we have to first check the rate, rhythm and the boundary of the arteries. So for complete 1 minute we have to check. Check the upper pulse. It is normal. It is coming 72 beats per minute. So now I have informed the condition of the patient, what is the reading of the pulse, and then we have to put the padding. It is coming 72.
good clap. Okay, sir. So, well done, Madam Guru. Now is the time to evaluate the performance. So, could you tell me how you have performed as per the checklist? Did you perform? कैसे सीक्वेंस था कैसे प्रिपेयर
Wash the hands, prepare all the equipment, check the patient's identification, explain the procedure, purpose थोड़ा सा नहीं बताता है, and assist the patient in assuming a supine and sitting position. ये वाला थोड़ा सा place the patient's forearm straight alongside the body with extended straight on the upper abdomen with extended. ये वाला थोड़ा सा mistake हुआ.
और देखिए read it out.
If sitting, bend the patient's elbow 90 degree and support the lower arm on chair or on nurse's arm, slightly flex the wrist. Count and examine the pulse. Place the tip of your finger, index and third finger on the side of the wrist on the thumb side. Apply enough pressure to radial pulse. Use watch, count the number of the pulse beat for a full minute. Examine the rhythm and the strength of the pulse. Record the rate on the patient's chart. Sign on the chart. Report to the senior staff if you find any abnormality.
It is done as accurately as
मैंने sign नहीं किया बस
anything else you left?
कुछ और
Could you please tell anything is missing? Then it should have gone from the beginning, not to the end. Anybody? Students participation. नहीं था ना? Zero in participation. Very good. Okay, one more thing just come here. सबको participate जैसे मैडम बोले ना, each one you could tell them, read it out. What is the purpose? अपन को नहीं बोलने का है, because students have to learn, no? So we have to tell the student, you learn, you tell them. You have the things with you. So you tell one purpose is, if they tell 6 purpose, then it is okay, fine. Our things will be over. Come to the first step. What is your first step? Introduce yourself. That means your observation you will look. Where your observation is not on the topic, your observation is somewhere. Because she has not helped you to arrange in such a way that you all could view her. Patient is sitting this side. जबकि patient कैसे बैठने से आपको दिखेगा? Don't this would be the way to interact with the students. ऐसे बिठाना था, है ना? और next introduction नहीं हुआ. Then what else? Next step. Hand washing when to do?
Before starting.
What she did? No. After hand washing, she has collected this tray. Have you noticed? Usually अपन को इसको करने के बाद हाथ धोना जैसे हमारा पता है ठीक है इसको देख लिया ठीक है you have hand. How the hand washing is done? Is it done in a sequence way? Knuckles nails. Interlocking के बाद first knuckles. Then you go for thumb. Last step. नहीं last step तो last step. That is. तो जब आप कर रहे थे ना you could have told all of them. You practice please. कभी इनका involvement दूसरे लोग कुछ नहीं करे मतलब अपन का मोटो था क्या है स्टूडेंट हैज टू लर्न स्टूडेंट हैज नॉट लर्न एक तो क्वेश्चन ठीक नहीं था एक वी हैव नॉट टोल्ड आस्क देम टू डू इट आज आई एम डूइंग यू प्लीज डू इट है ना इन बिटवीन हां यू हैव डन वेल यू हैव डन sequentially like that you are teaching the student that way you have to express to the students in between and you could have told them to read it out and next step क्या किया अभी उसके बाद हैंड वॉशिंग देन ट्रे सेटअप देन she has to explain the procedure to the patient.
Procedure she explains.
Explain to it, है ना? कि that I am going to take your calls because what is the problem and there is a requirement, hence there is a requirement to do. ऐसा बताना है. मैं आपका कॉल्स क्यों ले रहा है? आप पूछे, जरूर पूछे कि what is your problem? It happens with everyone. मैं जब मैं भी गई थी, हमको भी ऐसी मतलब देखो कि after long years of teaching also we do these other things, है ना? तो उसको कैसे eliminate करना है? That only can be eliminated when you practice this. So that is the use of checklists. तो एक बार पेशेंट को क्या करें? एक्सप्लेन कर. बट कनेक्ट नहीं करें, ये आपके यही कारण के लिए हमको ये लेना जरूरी है. एंड व्हाट एल्स कंफर्मेशन व्हाट्स इट?
No. She asked her name, patient name.
Then confirmation and patient also. Cases record to cases. नहीं cases देखेंगे. बस बोले कि आई सी. इधर कुछ बोलना नहीं. अपन को करना है. देखो, I am going to check now your name is Alka. Your age of 30. Bed number so and so. Okay. I'll go and check your pulse. So you have to convey. So you have to see the case. When आप you learn cases, you will see the cases. So student will learn that only. You will see the cases. They will not say cases throughout the time. So unless until you do, you take out and you tell them to reinforce again and again. आप नहीं देखा तो देखें. This is the case. You have a result का 10 years. Bed number is also good. Fine. ठीक है. उसके बाद क्या करना था? Next. Patient position. Proper position she has given.
Hand का वो.
Hand का क्या नहीं था?
In setting
Rest.
position. Rest करना था proper support के साथ.
ये hand था ना?
हाँ.
So you could have rested. जैसे जो आप हाथ पकड़ कर रखा है. It was hurted you even to the client for 1 minute. Because she is in अभी वो conscious है करके आप ऐसे पकड़ लिए. वो unconscious होता तो हमको resting पहले देना है. उसको पूछना भी position do you like to have? Either in lying down or sitting. And rest in his hand. You can see comfortable. So see the patient comfort. That is also lacking. Then next thing what happens? Tablet put, है ना? Second also place 3 fingers where? Radial. She has told कि you put in the thumb side. 3 fingers. What is the reason? Region of keeping
Because radial artery is
कोई भी आर्टरी हो 3 फिंगर तो लगाना पर what region every now and then what you do you have to tell the rational अपन बोलते हैं student you write the rational but we are not giving rational to students क्यों 3 फिंगर रखते red rhythm and उसका strength volume जो बोल रहे हैं उसको देखने के लिए you have to have and you will have little bit pressure also so that you can breathing उसको load कर सकते that is not being circulated कि what is the purpose behind it why patient को comfortable रखना कौन सा position से you like to have उसको बोलना what is the reason if patient is not comfortable आपका pulse मिलना भी मुश्किल हो जाएगा yes that is the one reason so you have to make him comfortable then you have to place in the proper side and count for the proper minute 1 minute she has done it after that record explain the things that the counts she has expected to explain to patient उसमें one चीज ऐड करना है कि you are forced because he is a patient उसको 75-85 से मतलब नहीं उसको क्या मतलब है your value is normal you need not to worry about it that you need to convey नहीं तो you will have 75 मेरा बढ़ गया उसमें कभी बहुत बढ़ गया सोच के कभी उसको कभी-कभी प्रॉब्लम भी आता है कॉन्सिक्वेंट इफेक्ट कभी-कभी किसी को तो कुछ भी आता है अटैक भी आ जाता है ना कभी-कभी तो इन दैट वे यू टू टेल देम दिस आर द नॉर्मल वैल्यू एंड योर वैल्यू इज लाइज विद द नॉर्मल सो यू नीड टू वरी देन शी हैज कम फॉर recording that she has did it well after recording she has repeated that request then patient को comfortable position दिए कि you please lie down no need to sit we have left out the patient care area. And we have only care for the equipments, recording. Patient and we have forgotten. That should not be. We have studied care, after care of patient, after care of the equipments, after care of yourself. After care of yourself, what you need to do? Then hand wash. Correct है आप? नहीं करते. ठीक है? This is what. So these are the sequence you need to maintain. This only will come when you do.
Yes.
And now she did it.
Yeah.
Any one of you can come and you can repeat the same. Let us see whether it is being diminishing
Yeah.
the gap.
Yeah. Yeah.
Yes, है ना? So 150 तक टाइम है जल्दी से और एक जना कर. Anyway, this is a small procedure we have started. Like there are many procedures.
अच्छा.
अगला केस दूसरा केस मिलेगा.
Today here I am to show the pulse. I am here to check the pulse of the patient. So I will be showing the procedure of pulse. First I will be going for hand wash.
मेरे जैसे पढ़ाना है. हाँ, all can do this.
Before going to procedure, we will see the definition. Can anybody of you read this definition of pulse?
The definition of radial pulse is checking presence, rate, rhythm and volume of throbbing of an artery.
Yeah, the definition of pulse is clear to all. Next, we will see the purpose why we are going to check the pulse. Man can to make the first two pulse purpose.
To determine the number of heartbeats occurring per minute, that is it, to gather information about heart rhythm and pattern of the beats.
And these two. Next, to evaluate strength of pulse to assess the heart's ability to deliver blood to distinct areas of the body, fingers and lower extremities.
To assess the responses of the heart to the cardiac medication activity, blood volume and the gases exchange. And last one, to assess the vascular status of the lady.
So here it is clear why we are going to check the purpose. Now we will start with the procedure.
Ready?
मैं आज आपके लिए नर्स अपॉइंट हुई हूँ, है ना. आपको प्रॉब्लम क्या है? थोड़ा गर्म भी लग रहा है, तो मैं आपका थोड़ा पल्स चेक करूँगी, है ना. मैं आ रही हूँ. फर्स्ट आई विल गो फॉर हैंड वॉश. I will take the solution. Then first we will, you can also do, repeat with me. First we will rub palm to palm, then back to back, back to back, then interlacing, then after that, sorry, tip of the finger, then next hand of tip of the finger, after that knuckle, both hand of the knuckles, then last one is thumb, then we will wash the hand. After finishing hand wash, we will see whether our tray is ready. So I am checking the tray. Yeah, my tray is ready. Articles are there, everything is there. For recording paper is also there, watch is there. So here I am ready to go for procedure. अभी मैं आपका पल्स देखूंगी क्योंकि आपको थोड़ा गर्म भी लग रहा है ना? कैसे बैठने से बैठ के कर सकते हैं कि लेटेंगे आप? बैठ सकते हैं। तो थोड़ा देर आप मेरे साथ मदद करिएगा, है ना? हम आपका पल्स देखेंगे, उससे या फिर आपको हम अगर ज़्यादा है जो भी है ट्रीटमेंट अपन वो स्टार्ट करेंगे उससे देख के। तो
मैडम इनको इस कोने में बैठाइए, ऐसा तिरछा हो जाइए, बस तिरछा, बस और बस परफेक्ट।
तो आप लोग इधर आ जाओ।
नहीं ठीक ठीक ठीक, आप लोग आ रहे हैं।
वो देख नहीं पाएंगे ना?
नहीं देख रहे हैं, यहाँ से दिख जाएगा उनको।
थोड़ा सा स्लाइड,
थोड़ा इस तरफ आ जाओ, इधर आ जाओ,
थोड़ा सा और।
बस।
we will keep 3 fingers, that is first finger, index finger and middle finger, just to the side of thumb, because here radial pulse is present, and we will not apply too much pressure. Just we will keep gently, and 3 fingers, the purpose of keeping these 3 fingers is to assess the rate, volume and strength. And I will be observing pulse for 1 minute. Consider 1 minute is over. आपका पल्स नॉर्मल है, आप चिंता मत कीजिए, है ना? ऐसे ही मौसमी बुखार होगा, आप बहुत जल्दी ठीक हो जाएंगे। Change my body, and now because it's normal, so I am not going to inform senior faculty, senior teacher, senior nurse. अब आप सोएंगे तो सो सकते हैं, या बैठना चाहेंगे कुछ देर तो बैठ सकते हैं, है ना? जैसा आपको अच्छा लग रहा है, ठीक है? बैठेंगे? Thank you, आपने मुझे कोऑपरेट किया, thank you. Now I will be going to replace the articles. I have replaced my article, and now again I will do hand wash. Again I have to repeat the same step. I will take the solution, then we will rub it, then we have to incubate, then count, then wash. Here I finish my procedure.
So you just say that from your. Can you evaluate or they will evaluate?
Yeah, first I will do that. एक मैंने पेशेंट से चेक करना नाम मैं भी भूल गई.
Starting you just अच्छा, or anything you have noted from the starting.
Introduce.
और दूसरा रूम में लेना
नाम नहीं बोलना ना पहले.
नहीं किया ना?
नाम पहले
I am only. Who is you? Who are you? I am बोलने से कोई भी see will be blurring. Who is she? Whether a doctor, nurse, or somebody who believes. Who is she? So you have to introduce with your name. Name with your. Who are you in the staff? Whether a senior nurse, junior nurse, student, or a physician. Who are you? They will be blurring. Sometimes they may think that you are the physician. Even.
And they can introduce her patient.
Clearly, I am so and so, happy to see you. And then, what's the problem? May I know? After that, wait. Okay. Then it's required. It's जरूरी है कि मैं आपका एक कॉल जरूरी क्यों it is desired in the chart. लिखा है करके ना? आप कौन से लिए क्या? It is there. What else? Very good. Any other points you want to say? Next, anybody else can do?
Student को involve step.
Read learning steps.
नहीं, after introduction, what should it be? What should be done first? Either you go for equipment or handles. The handles who was improper? No.
Steps. Up and down.
position and you can practice whichever practice you want to develop the skill in that procedure. Okay, that we can say, because in one practice nobody will become the master in that procedure. So it may require a repeated practice of that procedure. After developing proficiency in that particular topic, after developing proficiency in that topic, then only we will allow them to go to the clinical exam. That is the main purpose of doing this, using checklist and skill practice. Okay. Now again, I will start from there. So what you have taking the key message from here.
And I have learned regarding the use of checklist and this point. This I can perform in my college and I can teach other student teachers also regarding how to use the checklist.
As well as teaching will be properly used.
What you have not done, that you have learned, no. So that part also you can include. What you have not done, that also you have learned. When I was telling you the steps of evaluation, there I have mentioned some points now. So after listening that, you come to know that this also we have to include in the checklist. That point you tell. आप जब परफॉर्म कर रहे थे तब आप नहीं सीखे, कुछ पॉइंट आप नहीं किए, मैंने जब रीड किया तो आपको पता चला ये करना है, वो पॉइंट भी आप बोल सकते हो कि वो भी आपके लिए लर्निंग हुआ ना। तो बताइए क्या लर्न किया? आप क्या नहीं किए थे, अभी मैंने बताया।
logical things where you have to make. Okay, who's ready? Who is ready?
more than together. We all are doing the same correct position. सारे को correct कर रहे हैं, but some like sequence is up and down or something is missing. So that's why we are using checklist. Just what the checklist go and they should not कमेंट नहीं होना चाहिए, कोई नेगेटिव पॉइंट नहीं करना है, सबको देखना है क्या मिसिंग हो रहा है. मिस्टेक नॉट फॉर सिंगल पर्सन, ये जो मिस्टेक होता है किसी एक का नहीं, कभी आपसे और कभी आपसे होती है. रूल्स के मतलब वी वांट टू इम्प्रूव आवर प्रैक्टिस, वांट टू इम्प्रूव आवर स्किल, वी बिकम अ बेस्ट इन नॉट ओनली नॉलेज बट इन क्लिनिकल एरियाज, प्रैक्टिस एरिया आल्सो. So for that we are using this speech, not for even go wrong or correct or make a mistake. ये स्टैंडर्डाइज हम लोग ने अपना भी बनाया था, स्टैंडर्ड ह्यूमन डायग्नोसिस और एजुकेशन. तो सेम वी हैव यूजिंग टू प्रोवाइड फॉर कॉलेज आल्सो. सारे कॉलेज में दिया जाएगा, स्टूडेंट इसी में करेंगे सर फॉर व्हेन यू गो टू अदर कॉलेज फॉर प्रैक्टिकल एग्जाम. तो हमारा प्रैक्टिस अलग है, उनका प्रैक्टिस अलग है. पैनिंग कोर्स का जैसे आई वाज प्रिपेयर्ड एट आईसीटी सेशन, तो इट शुड बी सेम इन एवरी कॉलेज. पैनिंग कोर्स always different in history college. Now say I enjoy now well हो गया. So there is lots of difference in practice nursery college and hospital. So ISC want a singular type of procedure or same steps must be following all in here. That's why we are following this type of making this subject as using both steps. Now we have to move further. किसी के पास चेकलिस्ट नहीं है क्या? काफी लोगों को
है बैठिए। are good co-teachers, they are confident in themselves. And now they are looking to a teacher to teach them to take it right and take it. That only will make them habit of doing the things that should do them. Are you clear with this? Yes. Okay, thank you so much. We are here only few hours outside to discuss करेंगे. I'm not closing the discussion right now. I'm here only to catch up. जब भी नई टीचर आती है ना क्लास में, हर किसी को क्यूरियोसिटी होती है कौन है, who this teacher is, what's her name, right? She is in very beautiful sari, she is in very beautiful, he is very handsome, he is looking very, so everybody is curious to know. So students का वो anxiety और वो interest और वो curiosity खत्म करना बहुत important होता है before you are asking them to learn with you or learn from you. Very very important. Anything else from group B? So that is the topic demonstration. We are not going with the content. Proper positioning of the things, that is the topic content. I am talking about the methodology as a checklist.
With the students
Students, psychological safety. That we have covered psychological safety, everything, right? Anything else other than that?
knowledge of students.
Previous knowledge. So we can ask something about the different kind of things. We can always understand. That's what I told. Never ever think that you are the persons who are experts. Think the students are more intelligent than what I am going to teach. Teach your students as a facilitator. Don't teach your students as an instructor. I'm trying to say here, don't ever understand or don't ever assume कि students को कुछ नहीं आता, मुझे ही आता है. Consider that students मेरे से ज़्यादा अच्छा पढ़ के आए होंगे. Let me understand what they know. That's very 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 important. Where you can make a good idea with the students, where you can encourage the students to speak on the topics. That's very important. Very good point. Anything else from group B? Covered? Okay, group C. Humans. Betty humans.
We can develop leadership quality in some of the students.
We can
Develop leadership quality.
how we can do that?
And we are making them practicing to do the procedure. So it will rehearsal their personality and they will have a control over their group. They can check whether which area is wrong or right, and it will enhance their leadership.
That's the reason we are letting them to learn independently with the checklist, and they are good to go with the things accordingly. So that's very good point that we are encouraging or we are incorporating that component in our students when we are asking them to learn from peers and learn from the checklist which we have given to them. Okay, thank you. Anything else from group B? Group C, sorry?
All the participants can learn all the steps.
All the participants can learn
All the steps.
all the steps.
And they become experts.
How will you ensure, that's very good point, but how will you ensure that the whole participants of group 12,
Everybody is going to repeat all the same steps.
okay,
After some time they will expert on that particular procedure.
how it is possible? I am doing some procedure here.
We are using this checklist.
Checklist.
And with the help of checklist, once if any point is lacking, then next time we can just eliminate that lacking. And then after that we become an expert on that
Okay.
particular
Okay, I got it. So students are able to learn the whole steps, they are not missing anything else. Anything else you want to add on?
It was very easy to understand, ma'am.
I am just asking about the methodology. Yes ma'am, please speak out.
After doing the demonstration and listening the steps of procedure, it was very easy to understand how we have to do the procedure, and it is very useful to memorize.
Yes, it's good point that you are highlighting the importance and purpose. I am asking the methodology component. How will you ensure that your students are able to understand the whole procedure? What just ma'am has said. Anybody wants to say something on this? Checklist is already there.
Involve every student.
Involve every student.
What they are doing, they are happy or not.
Okay, anything else?
We ask the student why they are happy or why they are not happy.
Okay, we are taking their consent for agreement or disagreement. Anything else?
Set ground rules.
Okay, we can say some ground rules. Anything else from this side? How will you ensure that every student is able to understand the every step of the procedure?
Like when we are introducing our articles, we can call them one by one.
Hand holding?
Yes.
Yes, hand holding.
And then we can tell them like in MUPAT, we can tell them you check. I'm telling you, you can check the.
Okay, that is the equipment orientation. Anything else? Okay, sorry.
For every step, rationalization should be
Very important to make them the subject expertise. Anything else?
Communication.
Communication. Anything else?
peer evaluation.
Peer evaluation, ma'am.
With the help of checklist, we can help to students to make sure that how to do the procedures.
Okay, good. Anything else?
They can remember.
Anything else? Psychological safety, equipment hand holding, checklist, covering the whole procedure, delving the students into leadership skills, involving them with a good communication, maintaining an IPR. But most important is your subject expertise, your eye contact with the students, and your students are in a position that they are able to see the whole things. 12 बच्चों को इधर खड़े करना, it's your responsibility, not student responsibility. Student will never see मेरे को दिख नहीं रहा मैं. Every student I need to say. Students are always escaping. Sometimes they are not mentally with you. So you as a teacher have to ensure that my student is able to check the whole thing what I am doing. How I am inserting the cannula. How I am checking the pulse. मैं यहाँ pulse check कर रही हूँ. Are you able to see? मैंने हाथ किधर रखा हुआ है? 3 fingers. Are you able to see? So if I am doing like this, are you able to see now? Yes. So this is very important. So this is what we have to follow in the checklist. The most important observation which I made from the 2 checklists here, you have to use the checklist for every procedure. Forget students will say teacher is reading and it will not. I taught you procedure. Did you feel I am reading and I am telling? No. It's not based on that. You have to read and you have to do the procedure so that if I am reading when my student is doing the thing independently, I should ensure my student will read. उनको लगेगा मैम नकल मार के पढ़ा रही थी, मैं भी नकल मार के पढ़ूंगा. This is what I want to inculcate. This is what I want. Let the student comprehend the things. That it is very very important. Use the checklist so that you are not missing anything. जब हम चेकलिस्ट पढ़ाने लगते सबको लगता है मैं भूल गई, क्या कराना था भूल गई. भूल जाओ कोई बात नहीं, बट आपके पास लिखा हुआ सब कुछ है. Read it, do it. Read it, do it. Read it, do it. 50 steps, read. 50 steps, do. You got me? Yes. Anything else you want to add on so that we can start with the OSCE then? Are we clear with the things? Anything else which I am missing? Anything else you want to add on? Right? So shall we start with the OSCE for 10 minutes?
Yes, yes.
I will take 10 minutes, then we'll go for lunch. I think you must be hungry.
Now you have to manage the time though, because we have spent.
So now we have the, am I audible at the back? Do you need me the mic? Am I audible at the back? Yes. Okay, so now as of now what we have covered skill teaching and practicing. 2 things, skill teaching done by a teacher, skill practicing done by the students. But दोनों ही बंदे नकल मार के पढ़ा रहे हैं और नकल मार के ही पढ़ रहे हैं. ये बात नहीं भूलिए आपने. Are you clear with this? Yes. Everybody has to use the checklist, whether a teacher or a student. Point is that we want our students to get in here, and this is possible only when you multiple times read, when you multiple times do, and when you multiple times understand. So skill teaching and skill practicing is being used with the procedural checklist, the one activity we have just covered. Now we are coming to the skill evaluation. यहाँ पे बात आती है जब हम नकल नहीं मारेंगे. टीचर्स तो मारेंगे बट स्टूडेंट्स नहीं मारेंगे. Right? So what we are going to do here, we are understanding how we have to conduct an exam and how we have to evaluate a student using the OSCE. So what is objective, structured, clinical examination? So what do you mean by objective here? Through observation. There is no subjectivity. If I am saying I am washing hands, will you give me marks? No. If I am washing hands, then only you will be giving marks because you are observing how I am washing my hands. There is no subjectivity. There is only objectivity. So we have to ensure if my student is doing something, I am giving him a mark or her a mark. If my student is not doing anything, I am not going to give a single score. Are we clear? Yes. Okay. evaluation method. ASCII is not to be used to teach. Teaching ke liye we are using the checklist. There is a procedural checklist, there is a ASCII checklist. Both are checklists, but one is a procedural checklist and the other one is an ASCII checklist. So it is designed to test the skill performance, which is clinical skills, and competence in a range of skills. So we are understanding how competent my student is and how my student is performing on the particular step. So what is the full form? They have written objective. So why it is objective? That we are using the person with their observations, teacher's observation, right? And structured that every student is getting the same problem. It is not like that. It's based on my favoritism. I'm a teacher, I like roll number 5, so I will be giving him an easy skill. And it is sometimes the halo effect. You know what is halo effect? Yes. What is that? Hawthorne effect? You know all the effects. So what happens? I'm in a good mood. I'm giving all easy procedures. I'm in a bad mood, I'm giving tough procedures. Or I'm in a good mood, I'm giving good score. I'm in a bad mood, I'm not giving good score. Or this student was very bad in the whole year, but today he is doing good, still I'm not giving marks. It should not be that. It is an objective. मेरा सारा साल एक स्टूडेंट अच्छा नहीं पढ़ रहा था, तो आज अच्छा पढ़ रहा है, तो आज उसको मार्क्स मिलने ही मिलने हैं. That is what we are understanding here. So this is free from any kind of biasness. This is free from any kind of favoritism by a teacher. Do you all agree? Yes. Yes? So clinical. Clinical means whatever the situation you are giving, that should be real facet, real time complex things. It is not like that I am asking the student to measure the weight of the hair here. I am not asking. I am asking my student has to perform some hands-on skills where psychomotor skills can be updated by the students and I can understand that. What is next is examination. We are assessing the learners. So when you talk about the structure, it is mentioned same problem, same task. Are we clear? So all 100 students will be assessed on the same procedure. Do you think it is possible? Yes or no? Please raise your hands with yes. 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 How? Can I have 2, 3, 4, 5, 6? Okay, ma'am. What do you like to say? Last year. All 100 students.
As we are teaching them through the checklist, the same procedure they have to follow. And when we are asking them to practice in their labs, they are having the checklist. And that on that basis only we are preparing, we are giving the numbering.
Okay. Okay. Thank you, ma'am.
By creating a number of office patients, we can increase
Number of?
office stations.
Okay, so we can increase number of ASCII stations. So I don't have multiple teachers to increase the number of ASCII stations. I can involve whole college, whole teachers for the exam of second year. Is it possible? No, it is not possible. Your principal ma'am will not allow. It is not possible. We cannot let the other students suffer because there is exam of second year. Do you think? I'm taking exam of OBG, I'm taking exam of medical surgical, I should be expertise in that. Then only I can conduct the exam. Do you all agree? Yes. So how is it possible? Anybody would like to say? Yes. Who else? Yes. Akanksha ma'am said yes.
The case scenario.
Sorry?
Case scenario. Different part.
Okay. So now I got the case scenario. There is a mother who is about to deliver a baby. So in one ASCII station, I have given them a card that you will be communicating with the mother and explaining the procedures. The second student is getting a part that you will be cleaning the perineum. The third student is getting a part you will be cleaning the.
Yes.
You will be conducting a delivery. So which part you are finding is easy? एक प्रोसीजर ले लिया मैंने नॉर्मल जनरल डिलीवरी उसको 3 पार्ट्स में डिवाइड कर दिया. फर्स्ट पार्ट इज communication, second part is cleaning, third part is conducting delivery. Which part do you think is easy out of 3? First. So आज मैंने 20 स्टूडेंट का एग्जाम किया. IELTS यही बोलते हैं ना 20 स्टूडेंट्स इन अ डे. Yes. आज मैंने 20 स्टूडेंट्स का एग्जाम किया. that is not going to serve our purpose. 100 students cannot be utilized for the same exam for the same day. Either you have to start from 6 o'clock in the morning and 12 o'clock in the midnight possibility, or you will increase your teachers that you can at multiple stations, at 5 stations only examination is going on, and next 5 stations only conduction of normal general duty is going on, so that every student is being rotated accordingly. So how possible it is to ensure that every student is getting the same procedure on all 100 batches or 100 students?
With a different station with using checklist.
Yes, we are using checklist. Station different है, पर उसमें आप सारे students की uniformity कैसे लेके आ रहे हो?
It's a different parts we have divided and the checklist from each part will coincide with each other.
That's what I'm saying. कि आज मैंने ग्रुप ए का ऑस्की कर लिया, ग्रुप ए को मैंने ऑस्की में दे दिया, इनको 3 प्रोसीजर पे ऑस्की करा दिया, एग्जामिनेशन, कम्युनिकेशन एंड कंडक्टिंग नॉर्मल जनरल ड्यूटी. कंटेमिनेशन हो गया ना, they will be going and telling you either that is not feasible. Same day practical conduct करना through OSCE not at all possible. And it is not at all possible that ma'am will free whole college for conducting the exam of second year. Is it possible for you? Will you free all teachers to conduct a morning class?
No, that is not
possible. So what is the possibility now? Because आज मैंने 20 बच्चों का एग्जाम लिया, कल मुझे 20 बच्चों को और लेना है और मुझे इंश्योर करना है कि उनको सेम टाइप ऑफ टास्क मिले. I have given you a hint. Same type of task. But same task is not possible. So standardization, when they talk about structure, it is not possible to go with the same task. You have to change a bit of it. You have to identify as an expert, as a teacher, that I am going to evaluate my student based on these 20 procedures, because these 20 procedures has the same difficulty index. One student is getting engine session, the other student will get the catheterization. You got me what I am trying to say? You have to identify the difficulty level of whole procedures in first year. Then you will be dividing so that students should not feel biased. Today you are teaching the cannula cleaning. Tomorrow you will be taking the catheterization cleaning. And third day you will be taking the engine cleaning. So can it be similar kind of task we are giving to the students? Yes. But with little variation. So that is the only possibility where you can avoid the contamination, and that is the only possibility where you can keep the same kind of task for the whole class. You got me? Yes. You got what I am trying to say? Difficulty index is going to work here. That is the only principle, that you have to identify what are the similar 5 procedures which I can run for all 5 days. It is not dividing the one checklist in 3 procedures. That is not going to help. Because there will be one task which will be difficult than the other task. So dividing a checklist is not a help. Dividing the procedures in a way that everybody is getting the same kind of difficulty level. And the students cannot be contaminating the things to the other students. Are we clear to this? Yes. Any doubt as of now? So you have to identify. So giving you one last example in this. Suppose for third year students, I want everybody should go through the newborn resuscitation. Because that is the particular thing I want every student should be assessed. अगर मेरे किसी एक बच्चे को NBR नहीं आता तो उसको पास नहीं करूँगी, 4th year में नहीं जाने दूँगी, क्योंकि that is very important thing. Every nurse should know. So now what will you do with that? You will make a scenario. Sushila ma'am ने highlight किया था ना. You will make a scenario and you will keep the same kind of procedure but with little changes in the scenario. Today I am giving the procedure that the baby who is not breathing but with meconium aspiration, there will the skill will be changed. Tomorrow I will be giving the baby who is not breathing just because of other problem. But I will try to keep that particular task for each student, because I want to evaluate one student not only for the particular task. I want all 100 students to be assessed through this particular task which I am given. So you as a teacher should be a critical thinker where you are deciding that how I can make the standardization in conducting the exam of my whole class of 100 students. Are we clear now?
Yes.
Yes? So we'll get more idea with the further things. I will just go through this. So, how we are going to evaluate the students? By using the skills we are assessing, communication skills, attitude of the students, theoretical concepts, sometimes interpretation. So when we are conducting the OSCE, through OSCE I can understand and I can assess the students on these all areas. Talk about these skills, we have to use the OSCE. So when you are conducting OSCE, you can assess interpreting the results. When you are conducting OSCE, you can assess how their competencies are being maintained. So you can do multiple things and how they are communicating with the students. So what are the exercises? Basically you need time, you need place, and you need persons. I will be talking on these three in a very brief. I will be talking on time. You are clear with? We need a time because 20 students exam, I need 3 to 4 days to conduct the exam. I need to understand that how much time I give given to all students. So if I am giving one skill for 3 minutes or 4 minutes, I have to give all skills of 3 to 4 minutes. So that's another time when my critical thinking as a teacher will work here, that whenever I am identifying the task, it's not one procedure is longer, the other one is shorter. You got me? What I'm trying to say? So you have to figure out कि मैं अगर आज 5 प्रोसीजर करती हूँ तो 5 प्रोसीजर में मुझे 5-5 मिनट ही देने हैं. पर क्या होता है, कुछ प्रोसीजर्स मेरे लंबे होते हैं, कुछ प्रोसीजर्स छोटे होते हैं. उस केस में आप अपनी चेकलिस्ट को डिवाइड करोगे कि इसमें मैं कम्युनिकेशन नहीं देखूंगी, इसमें मैं डिस्पोजल बेस नहीं देखूंगी, पर मुझे बीच वाला. You have to identify the OSCEs in that way. I am not going to cover the whole OSCE. NVD with AMTSL, normal vaginal delivery with active management of third stage of labor, it is possible to match with the newborn resuscitation? No. So what will you do? You will make 3 stations: NVD, AMTSL, and newborn resuscitation. You will divide your checklist OSCE in a way that you are covering the whole steps. At one table, they will be conducting AMTSL. At another table, they will be conducting normal vaginal delivery, and at third table, they are conducting the newborn resuscitation. You got me? So you have to divide your checklist here because you want to give the same time to all the students. You got me? Yes or no?
Yes.
Okay. So what is next is place. So I will be showing you one thing here. So when you talk about the place, if you are using the task planner, you number of students coming to me and how I am going to conduct the OSCE. So if I am keeping the OSCE in one single room, I have to adjust the place and space in a way. And if I am using something with some interpretation, I have to keep that space accordingly for the students, that there should not be any disturbance and the students are not panicking accordingly. So that is very, very important when you are managing your place. So in the first thing, they are talking about scenario to be completed. What I want my students to perform, I should have with me. आज मुझे उनसे क्या करवाना है? That scenario and that checklist should be with me as a teacher, as an examiner. Instructions for learners. So what do you mean by instructions for learners? What kind of instructions for the students you would like to give?
Time management.
Time management. Anything else? Students are going to enter at a time. एक ही टाइम में अंदर घुसेंगे और 5 मिनट एक ही टाइम में बाहर आएंगे. कौन से रूम से उन्हें अंदर जाना है और कौन से रूम से बाहर आके कौन से रूम में जाके बैठना है? वो क्यों? ताकि वो एक दूसरे से बात करें. कंटैमिनेशन प्रिवेंट करनी है. मैं बाहर आके बच्चों को बताऊंगी नहीं कि मैंने मैम के पास आज ये प्रोसीजर किया. So I have to ensure where the entry and where is the exit point, so they are not meeting with each other at any point of time. So that is very, very important. So instructions for standardized patients, already we have discussed how to prepare your standardized patient. Next, skills assessment stations with necessary models, mannequins and SP. This is for you as a teacher. कि आपको कौन कौन सी चीजें रखनी है. Next is assessment tool. We talk it procedural checklist which has to be converted in a OSCE checklist, right? And next is an assessor at each observation station. So many times there are two types of OSCEs, manned and unmanned. You have an idea about it?
Yes, yes.
Okay, so raise your hands who know about this, manned and unmanned. Okay, sir, would you like to say something a bit on it?
So, out of 5 stations, if you are making 5 stations, out of 5 stations, 2 stations we have to arrange either standardized patient, otherwise any dummy, to observe the procedures. And in unmanned station, we have to make some scenario or disease conditions or some skull and identify the parts, identify the
Perfect, perfect. So this is like when you have less resources. So you can keep some procedure on which you don't need a assessor to be observed. Psychomotor skills assess नहीं करेंगे, उसमें हम क्या assess करेंगे? Interpretation. मैंने ECG strips दे दी. I want the student to write what is this ECG strip talk about. Whether this is a ST elevation, whether this is a MI patient, whether this is with fibrillation, whether this is with some cardiac problem, or this is something related to stroke. So I will be keeping 5 स्टेशन है मेरे पास, 3 स्टेशन पे मेरे पास लोग हैं जो असेस कर रहे हैं, क्योंकि मुझे आईडी असेस करना है, मुझे पल्स असेस करना है या मुझे कैरेक्टराइजेशन असेस करना है. पर 2 प्रोसीजर में ऐसे रख दूंगी, एक पे मैं अल्ट्रासाउंड फाइंडिंग्स रख दूंगी उनको लिखने के लिए, दूसरे पे मैं कुछ भी इंटरप्रिटेशन ऑफ ईसीजी और एनीथिंग एल्स. सो दैट विल बी अनमैन्ड स्टेशन. You got me? But the time should be given equal again. Unmanned station can be run separately, manned station can be run separately. Because unmanned station पे आपको सब लोगों का रहना जरूरी नहीं, आप एक बंदा 3-5 स्टेशन पे unmanned बना सकते हो. So we call it OSCE and OSPE. You understand OSCE? OSPE is practical examination, just like a viva. I am giving some checks, they are writing it and they are moving. So this is the way we can plan manned and unmanned station. You got it? The last one is uniform time limit for all the stations. Again, I have discussed. Yet you have to identify as a teacher that how much time I need for particular station so that I can plan the next station in the same given time. I am not using NVD AMDSL as a stretch. I will divide this NVD and AMDSL into different stations so that I can make it uniform for all the stations for the same time. Are we clear? Yes. So here is the personnel. Other than an assessor, we need more personnel. So there are 2 people. One is assessor. One is a person who is a marshal. We call this person as a marshal in the middle. What this person is doing, he or she is the person who is coordinating. कौन से स्टूडेंट्स किस रूम से किस रूम में जाएंगे और कौन किस रूम से वापस आएंगे. So that is the responsibility of a marshal. And teacher can do all these things. आप अपने स्टेशन पे खड़े हो, 5 टीचर्स, पर आपका को गाइड करेगा कि आप रूम नंबर 1 से एंटर करोगे, रूम नंबर 1 के एग्जिट गेट से बाहर जाओगे. So there is a marshal is the person who is coordinating from where the students will enter and from where the students will be exiting, so that there should not be any contamination. You got it? Yes. The other one is a time recorder. This is very important. You know that being a teacher, being an assessor, you cannot record the time and you cannot make a buzzer. So this all instructions you have given to the students. जब बेल बजेगी, आपने इस स्टेशन से दूसरे स्टेशन में जाना है, और जब लंबी बेल बजेगी, आपको सबको 5 को एकदम से बाहर जाना है. You got it? So that is, you need 3 people for the OSCE, and depending on number of OSCEs, you will multiply with that. Right? Okay. So this is one. Just you. So you will be writing on which pulse. Let's say. So instructions to student. Student को आप क्या बताओगे? आपके पास student आ गया, उसको क्या बोलना है? At this station, you are required to take the radial pulse. This is the only giving to the student. At this station, you are required to check the, required to insert the IV calibration. At this station, you are required to do the active management of 3rd stage of labor. This is the instruction you are giving to the student based on your scenario prepared. marks. There's a number of students. So एक sheet पे आप 3 students को evaluate कर सकते हो, 5 को कर सकते हो, 10 को कर सकते हो, that is up to you. So when you talk about the observation, the first is arrange the articles, identifies the patient. So if my student is arranging the articles, that can be my task. एक स्टेशन में हमको यही दिया है कि आपने लेबर ट्रॉली प्रिपेयर करनी, यही टास्क है उसका आज. Suppose she missed any equipment, how many marks you will give out of 1? If suppose मुझे आर्टिकल प्रिपेयर करने के लिए आपने बोला रखना भूल गई उसमें, तो आप मुझे कितने नंबर दोगे? 1 दोगे, 0 दोगे, कितने दोगे? हाफ दोगे. हाफ मार्क नहीं मिलेंगे मेरे को, तो फेल कर दोगे आप मेरे को? सॉरी, okay, raise your hands who will be giving me half marks just because I am a good student. Don't you find I am a good student? I am not a good student for you? I am. I am. You are my seniors, right? I can be your student for 5 minutes. So, do you think I am a good student? अब मैं आज सिर्फ gloves रखना भूल गई, तो आप मुझे half mark नहीं दोगे इसमें? क्यों? So bad. So gloves is important. Okay. Skip the gloves. Okay, मैं एक let's say एक gauze piece कम रखा है मैंने. मेरे को मैम ने 5 gauze piece पढ़ाया, मैंने एक gauze piece कम रखा है क्योंकि उसकी कोई importance होगी. तो आप मुझे कितने marks दोगे? 0 ही दोगे. Why is it so? Good. You are very good. You are understanding the concept. Why is it so? So it is. Sorry. Okay, counting is important for step procedure. Yes, we can say. अगर मेरे पास 4 कॉल्स में पड़े तो भी डिलीवरी हो जाएगी ना. फिर भी आप मुझे 0 नंबर दे दो. Okay. Anybody wants? It's my good friend or my good teacher here.
There should be transparency. All should. If I am giving marks to you, means I am favoring you.
Yes, very good. It's not about that. It's about I have done some mistake, I should not get marks. There is no half mark in OSCE. If I have done something correctly, I am getting full mark. If I have done something incorrectly, I will be getting 0 mark. If I have done some half thing, I will be getting 0 mark. There is no 0.5 marks out of 1. कि चलो आधा तो किया है. In that way, you can make the standardization because that's your way. She might be my good friend. She is considering I'm a good student for her, but she is considering I'm a very bad student. मैंने दूँगी इसको half mark. पर वो दे रहे हैं, तो standardization disturb हो गया. So हमारा एक ही principle होता है. Completing the task fully, we are giving full mark. Completing the task appropriately, we are giving full mark. Completing the task inappropriately or incomplete, we are giving 0 mark. There is no half mark in OSCE. You get me? So it is all that we have to understand. If my student has done something, then we are giving. So this is why it is written there, but I just told you, right? Okay. Now you see, this is already we have discussed. I'm not going to discuss it here. So now you see, I'm going to conduct the OSCE. I have 5 tasks which I have identified here. NBR, interval IUCD, parchograph, HB estimation or BP measurement. So these are the 5 tasks. So 5 students are coming. Bell बजेगा. 5 मिनट के बाद bell बजेगा. They will be going to the next station. 5 minutes के बाद bell बजेगा. They are going to the next station. 5 minutes के बाद bell बजेगा. They are going to the next station. 5 minutes के बाद bell बजेगा. They are going to the next station. कितने minutes लगे? Minutes, total minutes. 25 minutes में मैंने 5 स्टूडेंट का एग्जाम कर लिया. 25 minutes for 5 students. Think about मुझे बहुत सारे स्टूडेंट्स का एग्जाम करना है, right? So 25 minutes में 5 students का एग्जाम कर लिया मैंने. Now they are dispersing and they are not meeting any of the students standing in here. You got me? So they are dispersing in a way that they are not going or they are not getting any opportunity to meet any of the students. Right? So what is next? Bell bajegi. Next 5 will be coming and they will be starting with the OSCE. Are we clear? So जो bell मार रहे हैं वो कौन है? Master. टाइम रिकॉर्डर। जो बेल मार रहा है वो कौन है? टाइम रिकॉर्डर। एंड जो उनको इधर उधर लेके जा रहे हैं नहीं हो रहा वो कौन है? एंड असेसर कौन है? ये 5 टीचर्स। You got me? So this is the way we have to conduct the OSCEs. There are more nitty-gritties in the OSCE. Definitely we'll discuss there when we'll be in the groups. It is not still being covered. I want to discuss more of that. But जब आप करोगे ना hand holding तब आपको ज़्यादा doubts भी आएंगे. ऐसे doubts नहीं आते हैं, right? So what's next? During OSCE. क्या करते हैं हम? During OSCE we are observing learners' performance. So being a teacher, I am nowhere to miss any observation. मुझे कुछ ऑब्जर्वेशन मिस नहीं करनी है क्योंकि मैं फेवरेटिज्म के बेसिस पे मार्क्स दे दूंगी। स्टैंडर्डाइजेशन खत्म है। 5 मिनट मुझे स्टूडेंट नॉट बेस्ड ऑन दैट अच्छा हैंड वॉशिंग करे थे पता नहीं करे थे याद नहीं। No, it's like I have to observe because my marks are based on that. That's the way we will make the standardization. So do not duty of doing OSCE. You understand? OSCE means we are conducting the OSCE in the labs, not on actual patients. We are not doing on actual patients. अगर वो कुछ बहुत बड़ा ब्लंडर कर रहे हैं ना, let them do. आयरन इंजेक्शन देना था उसको आईवी देने दो। आईवी इंजेक्शन देना था उसको ऑरली देने दो। Because I know this is a mannequin. I will revive this patient if patient dies. So never ever interfere. Whatever the done by the student can be discussed later. You agree? Yes. Don't interrupt the students in between. After just picture of mine here. What it is showing, it's not I am just observing and giving the whole marks at the end. No. Observing, giving mark. Observing, giving mark. Observing, giving mark. Means marks not at the end. At the end, we are just entering the total score. So it is not like that because you are a human being first. बाद में आप एक एक्सपर्ट बन रहे हो, पहले आप ह्यूमन बीइंग हो, भूल सकते हैं, कुछ भी भूल जाते हैं हम, ठीक है? So it is very very important to assess your students and simultaneously score them for that particular step. And then total marks should be at the right. So can you ask me to stand for a while? Just stand. All of you. Take off your right. Now give your signatures with the left hand. Give your signature with the right foot. Right foot. Now with the left foot. Now turn back and give your signature with your box. Do it. Everybody should do it. We are recording it. Nobody is going to look at me and record. Try to do it.
Everybody has a short signature. Yes, it's right there name.
Yes, that is right there.
Like this.
Yes, the box.
You see?
No. So I'm not going to take. I'm going to finish it fast. So after OSCE, we have to review the performance of the students. And when we say reviewing the performance means not the feedback, which is all. ये अच्छा नहीं किया, ये बहुत अच्छा किया, ये आपने नहीं किया. Ask them, let them reflect. That's where we call it experiential and reflective learning. We'll be talking much of that tomorrow onwards, so I'm not just going to mention that. So point is that when I'm saying feedback, that means a reflection by the students. So it is like I want my student has to Ma'am, actually I forgot to wash my hands. हाथ धोने थे पर वो भूल गई. We are not washing hands. Then she knows the logic as well. अगर मैं उसको डांट रही हूँ, आपको पता नहीं हाथ धोने हैं, so क्या होगा? वो अगली बार से demotivate होगा students. So better to let them reflect वो क्या-क्या भूले हैं और वो इस चीज को अगली बार से कैसे improve करेंगे, right? The constructive feedback and we are determining the competent practices. So advantages of OSCE is uniformity, availability of the things, safety coordination, feedback from simulated patients or the mannequins. Stations can be skills which are we going to assess, and we are allowing the demonstration of any emergency procedures which is not feasible and possible in the actual patients, right? So what are the limitations? Knowledge and compartments. We are not actually doing on the actual patients. That is the limitation. Demanding for examiner and patient. We need a standardized patient and we need more resources so that we can conduct the OSCEs. More time, sometimes it may lead to more time in setting up the stations and it is time consuming. Sometimes students are distressed that I am being assessed for all 5 skills altogether. That can be the possibility. And the training of the teachers how to conduct OSCE can be the challenge. These all challenges are we can overcome. Being an expert, being a teacher, but if we want. These all challenges can be well taken care of. So that challenges that do the OSCEs. We can do OSCEs and we can do anything about it, right? At the end, I just want to say assessment is the engine which drives the student learning. So we have to assess not motivated. They should not feel criticized. They should not feel that they are not knowing anything. So be the facilitators. Stop being the instructors. Try to be more polite with the students. Try to make a habit that student knows more than what I know. That is very, very important. This is the only thing I want to say. Any questions? I am here to answer.
That's what we request one OSCE to be done in front of everybody. And is it possible to demonstrate once? Yes, yes.
We can do that, that's not a problem.
Then everybody will be together.
Lunch ke baad we'll gather here, then we can discuss in the groups. What do you say? Fine? Okay, so after lunch we'll be gathering here. I will be demonstrating one OSCE with you and then you will be doing the same OSCE with your students. Is it fine? आज हम आपकी demonstration भी कराएंगे, but here I will be giving one OSCE as a standardized way of doing the things. Is it fine? Yes. Okay, so now we are going for lunch. Okay, you can go for lunch. Thank you for patience.
Madam, lunch के timing also half an hour. 20 minutes. 20 minutes only. 20 minutes. So if you are
examiner's evaluation. Are we clear with this? Right? So we have a standardized patient with us. So ma'am, are you comfortable to be my standardized patient again? So we have Miss Akansha, who is 40 years old, female, come to an OPG with the complaint of nausea and vomiting again with the same problem you had earlier. So I will be having a student. If my student is asking you anything, then only you have to answer, otherwise you have to be quiet.
Yes.
Are we clear?
Yes.
If the student asks you which is you are not aware, please be quiet. Don't give the answers by yourself. This is important thing you have to tell. Sometimes students अपने मन से बना के कुछ बोल देते हैं, वो नहीं बोलने देना हमें.
what you understood from the discussion, you just brief to the students about it. And then you have to evaluate the student based on the procedure. What you have to do, your student will be here. You have to brief your student for the OSCE session. That's all. Yes, that's all. You can go there.
Take this checklist now. You take this checklist. That was fun. So can we now have
So your student is here. You can touch.
So you can use the mic, but you are okay. Everybody should be able to hear you.
Ma'am, here we know the student's name.
Yes. You can ask if you want. You just consider that you don't know anything except for student. You are external examiner. Go ahead.
Good morning. Can I ask your name, please? Good morning. Myself, Shri Raman, and today I am going to give you a OSCE station, and you have to. This is your patient, and so you have to give the pulse OSCE station for your pulse recording. So can you proceed?
Anything else you want to add on now? For your students? Same thing or whatever you want to add on, not the same thing. But she has told you want to add on something for her. The procedure on how to check a pulse that we learned in the morning. So everybody is going to give marks as per performance. Can you switch off the fans? No, you can
आज मैं आपके लिए आज के लिए मैं अलॉटेड हूँ। मेरा नाम शैलजा है। आपका नाम क्या है? आकांक्षा। मैं आपके साथ किस तकलीफ से आए थे आप?
बस ये अच्छा नहीं लग रहा है और तबीयत खराब है, मुझे थोड़ा नॉजिएटेड की फीलिंग हो रही है और थोड़ा डिप्रेस महसूस हो रहा है।
आपको इसमें थोड़ा गरम भी लग रहा है और आपको पल्स भी हो गई है। So first I will wash my hand. So I will arrange my tray.
I will give you be loud whatever you are saying so that everybody is able to hear you.
आप बैठे मैं पल्स दूंगी तो आप बैठेंगे कि लेटेंगे कैसे रहेगा? बैठ तो हाथ आप ऐसा रख लीजिए तो आपको अच्छा लगेगा है।
Okay, 1 minute is over. 5, 9, 7. So can I have the people who have given 9 marks? Just get up from your seats.
Setting.
9 people have last hand washing of the procedure सबने काटे हैं? किसी ने दिए तो नहीं? Right? बाकी सब जगह दिए हैं? So I would like to ask from ma'am first. Ma'am, what's your name? Sonia ma'am. Please be seated. Thank you so much. Sonia ma'am, how many marks you have given on point number 4? 1 mark? Based on what? Based on what? What is point number 4? Places the tips of his or index finger on the thumb side or on the wrist. This is the mark. आपने 1 number दिया. Based on what? How did you observe ma'am sitting there from this position? That's right. This is what happened. She supposed कि करा है तो ठीक ही करा होगा. But she will keep her hand like this. इधर से सही रखा है मैंने? नहीं. इधर से तो सही रखा है ना? So this is that supposing should not be done. We are not here for the subjectivity. We are here for the objectivity. So this is my humble request to all of you. Please feel confident enough to come here and adjust yourself in a position where you are able to see the whole procedure. Students को बुलाते हो ना उस जगह पे खड़े हो जहाँ सब कुछ दिख रहा है तो फिर खुद क्यों नहीं आना? खुद भी आना पड़ेगा. जी. Yes, that is very important. Teacher has to adjust herself to be at the position. I can bet nobody could see from this side or that side. Everyone see where she has kept her hands. So now I want to know from the persons like ma'am, you said you have given 9 marks for the first hand washing. Who has washed hands first time? Ma'am has washed hands? Yes. But I am so sorry. The steps were clear? No. Correct. Then what made you to give 1 mark? That was correct steps? No. That was correct steps? No. Who has given 9? That was correct steps? Then what made you to give 1 mark there? Same happened here? You have cut the marks at the last hand washing. But what about the first hand washing? The technique was not right. So we could give the 0. So now, please stand, you be seated. So now I would like to ask who is a very strict teacher here like me. She has given 5 marks. I would like to ask where you have cut the marks, where you have given.
Ma'am, first that hand washing first procedure was not.
आप मेरे को जो नहीं करे वो बता रहे हो. Okay. So first she has introduced herself. Did you give mark? She has introduced. Everybody agrees? Yes. She has introduced. Ma'am, did you give marks there? Did you give marks there? Okay. Second point. She explained the purpose and procedure to the patient. कितने नंबर दिए आपने?
इसमें लेकिन 0 मतलब प्रोसीजर पूरा नहीं मिला है. Procedure पूरा नहीं. Procedure she has not explained. This is the explanation.
She has not explained the procedure, but she has. Did she tell the purpose?
She has.
What is the purpose has been informed to you by your nurse? No. Ma'am, what purpose you have told?
No, नहीं आपका. I told कि आपका गरम थोड़ा लग रहा है मैं आपका पल्स लेके.
So is it serving the purpose of telling the purpose?
No.
No. Person is not knowing कि गरम लगने से पल्स का क्या. Again, I have cut marks here. Did you give marks there? Okay, no problem. Next, ma'am, did you give marks there? 0. So she is with me now. Okay. Next, ma'am. Point number 3. Wash hands पे आपने marks दिए? नहीं दिए. 0. आपने दिए? 0. Okay. Next. Assess the patient in supine position. Marks दिए?
हाँ, supine नहीं. She asked.
So she is confirming. So you have given marks? Yes, I have given marks. I have given marks. That was done. Okay, next.
Then
examine the pulse. 4th point. Count and examine the pulse. So you have given marks there?
No.
Why? What made you to cut the marks?
That placement of the hand was not correct. Fingers was not correct.
Okay. What about you? Okay. What about you? So what is happening now with me? I was not sure about this. क्योंकि मैं अपने आप को इस तरफ नहीं लेके आई. तो I try to see just for that case. then I'll give marks. This is another way of doing the things. Many times you can be distracted. Many times कोई एकदम से बाहर आ गया और the student ने procedure कर दिया. But don't give marks, don't cut marks until unless you are clear to confirm at the end. Just to ask how she has performed. Not to ask आपने किया था? She will say yes. Student will never say मैंने नहीं किया था. Just ask. Okay, can you show me how will you place your hands? Place your fingers. She will repeat the demonstration and you will get to know that she knows. Then you will give marks there. But that's a good observation. Okay, what's next?
Apply only enough pressure to radial pulse. That I am also confused how to assess that.
That's a very beautiful point. Please sit down. So now here is the question. Sometimes you get an obese patient. Sometimes you get an obese patient. For obese patient or the patient with some swelling on the hand, you have to press a little bit harder.
Yes.
So with the observation, you will be able to make it. So in that case, you can give marks and accordingly you can keep it. Or if you feel this is a subjective thing which I cannot assess or observe, you can skip it. You can make your checklist according to your understanding. You got me? So that can be done. Okay, what's next, ma'am? Using digital watch, you have given mark? Yes, she has used. Then examines the rhythm and strength of pulse. Did she examine?
Yes.
How do you do that? Did she verbalize? I have examined. Did she written in the document she has examined? You have not checked. So whatever is subjective thing, she has to write it here. Pulse is bounding. Volume is this much. Regular, irregular. Then only you will consider that she has done it. अगर उन्होंने बोला भी नहीं, लिखा भी नहीं, then you will not give marks. So documentation again speaks a lot about it. So you as a teacher will go and check the documents and then you will give the marks or then you will cut the marks. So I have given 0 in that because उन्होंने कुछ भी mention नहीं किया. But आपने उसको उनको 1 mark दिया, 1 mark दिया. So that is a biasness. You have given 1 mark based on your understanding. कल को दूसरा student आएगा उसको आप शायद नहीं दो. So that biasness we have to take rid of. You got me what I am trying to say? Am I making sense on the points?
Yes.
Okay. What's next, ma'am?
More times.
Document the reading on the patient pulse case sheet. Patient case sheet. Document the reading. उन्होंने document तो किया, but is it a complete documentation? Patient name is not there, identification is not there, date is not there. So you will consider it a 0. Incomplete, inappropriate procedure. Because document किया, but गलत किया, पूरा नहीं किया, complete नहीं किया, inappropriate किया, not giving the meaning. Then you will give a 0. You got me? So that's why I have cut marks here. And the last is wash hands. तो वो उन्होंने करा ही नहीं इसलिए हम उनको. You got me what I am trying to say? So now see, these many teachers, one student, multiple variations of marks. That standardization we have to make that if done properly will give mark, if observed properly will consider it, if not done properly will cut mark and will not give any half mark to the student. So this many teachers, but student is getting 50%, student is getting 90%, student is getting 70%. So that is the variation and that is leading to the misinterpretation of the student's competence. You got me? Okay, thank you so much. Thanks for participating. So now we are going to discuss in the groups. Then we are going to conduct the yes. If you want to shuffle, that's good enough. Can we shuffle? I think it takes. So any questions, any queries, I am there to answer. Some
queries they have asked, if patient will be dermatitis.
Wear gloves.
Wear the gloves to clean.
Yes, that is different situations and different things. How you are going to perform. But यहाँ पे हम content की बात नहीं कर रहे हैं. We are talking on the method. So that the marks can be standardized. I am talking on that aspect. Right? Okay, shall we move? Yes. Ma'am, groups कैसे?
Will 1, 2, 3, 4, 5, 6 like that.
4, 5, 1, 2, 3, 4.
Be quick.
2, 3, 4, 5, 6, 1, 2, 3, 4, 5, 2, 3,
3, 4, 5. 1, 2, 3.
So all ones can go to room number? Room number 7. All ones can go to OBG lab. They are going in the one, but afterwards they will be shuffled.
Yes, station number 1.
We can ask two classrooms are open there and they will meet every seat. Okay, then we can go on. All of them we can ask.
So anyway, one can go together, then two will go together like that.
All ones can
One number group will finish, two will go, then three will go, then four will go, then five will go. Because small, group is small. They will take individual repeat. But उधर जाना जरूरी है। ये बस है।
फोकस ना इसका फोकस करना देखते ये है माइक
आज पता नहीं फोटो खींचने वाली लड़की अब आई नहीं।
ये क्या नाम है उसका
स्वर्णिम
time you want to give to particular station, that should be equal, but that can vary from 3 to 7 minutes. Not longer, not less than 3 minutes. Because if you want to assess somebody, you should give some time. But if you are giving it for 7 minutes, the attention span of the teacher is also getting lost. So try to keep your skills, giving it 3 to 7 minutes. And the other thing is, if you want to keep your scenario. Now what you were doing, you were telling the students, at this station you have to perform IV. At this station you have to perform newborn resuscitation. At this station you have to perform CPR. It is totally depends on you. Better to write the scenarios and paste it. Students are coming, reading and started doing. It can be done, right? And accordingly, so there were some people who were little confused. There were 2 evaluators. The evaluators from Bhilai College, PG College of Nursing were not the teachers. They were just evaluating you to understand how we can help you further to identify the students' skills. But only one teacher will be observing the one student. Sometimes it happens that 2 teachers observing 1 student. In that case, that needs to be informed to the students that there are 2 examiners who will be evaluating you. So students should not feel panic or anxious to see multiple teachers who are going to evaluate. And every time you are not going to introduce yourself, and every time you are not going to take the introduction of the students. You know your students, you have to just read their roll numbers, or you can ask their name and you can start doing. It is not mandatory that examiner has to inform. Right? These all things happen as a group in a whole in one class, need not to explain everything individually by individual teacher at individual station. The aura of ASCII to understand is taking 5 stations. Once they are completing all 5 stations, they can disperse to the room where they are going to sit. Are we clear? This was only thing we wanted to tell you. This was the only thing we wanted to give you an aura. How we are going to do. The moderator. The things that all 5 stations are occupied with all 5 students. The moderator is making sure that all teachers are ready for the next student, because one student is using the gloves or one student is using the IUCD on the mannequin. The teacher has to be ready that she is prepared with the new IUCD. The teacher has to be ready that she is prepared with the mannequin is free for the next IUCD. Or the mannequin is free from, if I have inserted the cannula, so my bell is run, I have not taken it out. So that cannula is inside. Teacher has to get ready that next student is coming, before that she has to take that cannula and she has to ready with the new cannula. You got me? Am I clear? Yes. Or what is my observation I could see, whatever your ASCII sheet, that should not be visible to your students. That is your question paper. You will not show the student and you will not let the student feel that you are marking them simultaneously. Just be smart and be like in a more psychological, safer way, that you are identifying the students and you are smartly giving the marks. Don't let the students see what is written on the ASCII sheet. Procedural checklist we are giving to the student, but ASCII checklist is your tool, will be with the teacher, but never ever will be going to the students. Right? Anything else you want to see, but I could say, I may miss something, you can ask me, I can just clarify. Then do you want to add something or I can?
Madam, would like to respond. What is your observation?
Okay, ma'am, please.
Or anybody else who actually observed?
Yes, I will talk something.
Okay.
Yes. And add on something.
Yes.
What I observed was that when the examiner was distracted, like when the student is doing the procedure, they are seeing somewhere else.
Very important observation. That you have to not to miss anything. Just understand this is your own kid is being evaluated. The way you will observe others' kid, your kid will be evaluated by the other teachers. So just consider every student is doing only once. You must be doing for 50 times, but student is coming only once. So please be more honest. Please be more attentive, more conscious and more alert when you are giving the marks. Don't take it as a halo effect or Hawthorne effect that okay, student is good, I am giving good, student is bad, I am giving bad. So please make sure about this. This honesty should come with the teacher And I understand that difficulty of observing and giving the marks. That will come with the practice. That's not difficult thing. You will be that expert that you are able to manage both the things altogether. But the point is that when you are observing, simultaneously you are giving the mark. Not giving the mark but making a tick. Then marks can be given later. But that column should not be empty for later. You got me, ma'am? Anything else?
Yeah, the same step we have to put at it. Actually, sometimes what we do, like what I observe was, the examiner used to wait till the end. So that should not be.
That is not a principle of OSCE. I should not say that can consider. That is not considerable thing. Because we are human beings, we may forget कैसे किया था. I really telling you, it is not at all possible. मैं भूल जाऊंगी 50 स्टूडेंट की OSCE करने के बाद मुझे याद नहीं रहेगा इसने किया था या नहीं किया था. फिर वही होगा, हाँ ये अच्छा स्टूडेंट है, दे दो. आज वो very important to consider, right? Next.
Madam, one question. While evaluating one teacher, I saw that the student was not able to perform anything and she was just standing there. So in that situation, whether teacher will help or say something?
Okay, yes. Final exam.
Because it's your exam now, so you will no need to facilitate.
But she was simply standing.
Let her stand. That's what she'll get 0. Finally, you
Let
don't
her
need to
stand.
consider her to do something alteration or nothing like.
We will not.
If done, one, not done, no consideration.
Sushila ma'am, your point is that final में नहीं कर सकते but वैसे कर सकते हैं. This is what you are saying.
When we are practicing, by that time we can assist them.
No, point is that if we are talking about the internal exams, we are conducting in the same way.
Yes.
So, but point is that whenever the OSCE is there, whether this is a practicing exam, whether this is a final exam, internal exam, or whatever the exam, be for a single thing. We will just intervene for one thing where I skipped something and at the end I want to know whether student knows or not. But in a way I want us, the student to repeat but not asking done or not done. Do you get me what I'm trying to say? हमने student को ये नहीं पूछना कि अच्छा आपने head raise किया था, वो कहेगा हाँ मैम किया था. हमने ये पूछना head raise कैसे किया था. मेरा motive see, teachers including me, teachers का attitude क्या होता है कि we are pulling the leg many times. आता है कि नहीं आता देखते हैं. So we have to just get rid of that. We have to understand that we are here to understand what she knows or what he doesn't know or what she doesn't know. So never ever try to get into that कि उसको आता है कि नहीं आता, but try to facilitate कि उसको आता है तो कैसे आता है. So asking the question किया था कि नहीं किया था is not gonna help, but asking question कैसे किया था is going to help you whether she knows or not. So better to ask कैसे किया था, but not in asking yes or no. Go with the open-ended understanding rather than closed-ended understanding. You got me? Am I clear with this? Yes. Okay. Ma'am, anything else?
Madam, you can have your word. Meanwhile, I talk.
No, one question. Like this procedure was a pulse, radial pulse assessment that can be completed in 5 minutes from hand washing to the end of hand washing. But how we can complete the last insertion of IUD in 5 minutes? So if a checklist according to that the student will not get.
I have one question now. Please have you. Anybody would like to answer on ma'am's question? I think I have discussed all this. Yes. So who would like to answer? Who would like to answer? Ma'am, would you just tell me?
We can divide the OSCE, we can part to part, we can make the timing for according to 2 minutes. That much point only we will evaluate.
Okay, now I want to answer on this. So now one topic is pulse, which can be covered in 3 to 5 minutes. One topic is IUCD insertion. So my agenda is like मुझे सारे ही topics एक ही मिनट में मतलब उसी same time में खत्म करने हैं. I cannot give 5 to 7 minutes for this and 3 to 4 minutes for this. Every procedure will go in the 3 to 4 minutes only. So what I will do, I will skip the preparation part, I will skip the hand washing part in IUCD because IUCD is a procedure for the 4th year. Pulse is a procedure for the 1st year. So that are not important things to understand whether my student knows how to wash hands or not. My topic is to understand how he is learning the IUCD with the no touch technique. So I will be keeping checklist का pre and post procedure I will skip. I will keep only the middle part. So that way I can make the time standardized.
Then how the student will come to know that ki I have to only do that?
Very good point. Very good point. Very good point. Sheila ma'am is giving answer to this. You will keep the scenario written. You are already wear the gloves. You have already washed hands. Now you have to perform from the speculum examination. So student is clear. ये मुझे करना ही करना.
Like in NRP, we can ask them to start with initial steps. No?
Yes, that can be done.
Actually,
स्टूडेंट को हमें और रॉन्ग नहीं देना. स्टूडेंट को हम ये बोलेंगे आपने हैंड वॉश कर लिए, PPE पहने हुए, आपने सब कर लिया, आप स्पेकुलम एग्जामिनेशन से शुरू करें. So this way you can cut and you are giving the right information to the student. That does not mean that directly without gloves they can use it. Am I clear with this?
Yes.
So this way you can divide your time, and this is the critical thinking of you as an expert, as a leader, as a teacher. There are many ways. Everything should have a logic. Principle should be standardized. Anything else?
That is what we जो भी unit में थे, they are not clear about their what they are supposed to do. That we are not told. Then you will find a difference. है ना? Neither teacher don't know कि what she is going to do for the student. So that is what madam said. एक तो checklist teaching, checklist skill practicing. That practicing only teacher was doing, and we are observing the teacher. So teacher was not knowing that how she is going to utilize her checklist. That's the way she confused. And neither they are worried about the psychological safe environment, neither they are worried about the preparation of the present unit. She has to ask, क्या मैं करूँ, है ना? तो ये ऐसा है कि teacher has to, you know, the time limit with the 1 to 3 minutes. So you have to quick in your actions. And your teacher is so sluggish. So आ रहे हैं, हाँ ऐसा है, राम है, 70 है, points लेना है, ये है, वो है, 5 मिनट चला गया. The student has to go simply after wearing the gloves, he has to move on. ठीक, तो you have to be so quick in your action. That knowledge you have to keep in your mind. As much quick you will be, and your student will be act accordingly. So keep in your mind कि these all you need to do. जैसे अपन को बताने से it takes 1 minute, 1.5 minute तो चले जा रहा है, इसलिए fix it. So सबसे हमारा यही हुआ कि हम लोग we have not given you brief actually what you are going to do there. So thing is that is the way you have to utilize your critical thinking. You understand now कि एक IB patient है, मेरे पास ये चीजों है, मेरे को करना क्या, which step I have to do first, then which step I have to go for the next. So that way you are utilizing more critical thinking. Do you understand now? Utilization of critical thinking. So when you do, your critical thinking is being there, being involved. So now you know you can make the same type of OSCE in your lab and see the difference what you have done here and how better you have performed in your scenario in your lab. That you can do now. And the same procedures is there, same room will be there, with your teachers are there, with your student also you can do. So I think it will, first of all you were not clear about the what you are supposed to do. Otherwise आप लोग बहुत prompt है, आप बहुत जल्दी भी कर लोगी, है ना? So like that you have to quick in your action and quick in your critical thinking, have to apply and move on. That's all.
Okay, ma'am, you were asking something.
Ma'am, like many of the procedures, they are telling the steps. Instead of doing the procedure, they are telling the steps. So what we are doing?
Good observation. Good observation. Yes, you will not give marks until unless they perform. But what I want to add in further, please have a seat. So what happens? You have to tell this again to the students as a whole, which I could skip there. That students has to tell they need not to do. Because when they say other students are getting what is going on, they have to just perform. They are not going to verbalize anything until unless there is a communication with the patient. They have to communicate with the patient, they have to ask. But when they are doing some, I'm washing my hands, no. They have to just wash. I'm taking the candle of pink color, they have to just take. They need not to verbalize or utter a single word until unless that is related to the communication or any of the information to the patient which is required. Right? If they are just verbalizing but not doing, zero. We are checking the psychomotor skills. We are not understanding their decision making. We are not understanding their theoretical knowledge concept. We are understanding their psychomotor skills. How they are pricking, 15 degree angle ले रहे हैं नहीं ले रहे. How they are inserting, टेढ़ा करके डाल रहे हैं सीधा करके डाल रहे हैं. Insert करना everybody knows. कैसे insert करना is a question. So that कैसे insert करना we are observing here. So that is only possible when they perform. If they verbalize, need not to give any. You got me? Anything else?
वापस से हमको रीअरेंज करने शोल्डर और निकालना क्वाड क्लैम्प निकालना सब कुछ वो टाइम मुझे जो बेल बज रहा है ये टाइम
That will be given. तभी तो हम prepare करते हुए the person who is sitting at the time recorder, the person who is a moderator, they have to look after that all teachers are ready for the next student or not. क्योंकि एक स्टूडेंट ने शोल्डर रोल दिया है आके तो वो निकाल के साइड पे रखना है. आप शोल्डर रोल के साथ बेबी नहीं दे दोगे. किसी ने कॉर्ड क्लैम्प किया तो कॉर्ड पीछे आप अटैच करके रखोगे. Yes, you need time. Definitely. Yes, you need time. Definitely. This was a time crunch. That's why we have just rushed it, literally. But otherwise, it will give. तभी तो हम 5 scenarios for 5 मिनट 25 मिनट का टाइम लेते हैं. तो हम जब OSCE प्लान करते हैं तो हम 30 मिनट का सेशन लेके चलते हैं कि 5 मिनट मुझे preparation time भी चाहिए. So whenever you are going to plan the OSCE, plan in a way 5 stations, 5 minutes, 25 minutes for 5 students. Am I clear? But you will be planning it for 30 minutes for 5 students. 5 मिनट एक्स्ट्रा हर स्टेशन में आपको लेने हैं. स्टूडेंट को बाहर जाना है, स्टूडेंट को अंदर आना है, आपने सेशन चेंज करते हुए, ग्रुप चेंज करते हुए, स्टूडेंट चेंज करते हुए अपनी प्रिपरेशंस करनी है तो सारी चीज़ों में आपका आधा मिनट जाएगा. But you have to ensure that when you have 5 stations for 5 minutes, 25 minutes नहीं कैलकुलेट करोगे, आप उसको 30 minutes कैलकुलेट करके चलोगे. Always take 5 minutes for the next session so that you can prepare all these things. Clear? Are we good to go? Any other questions? So that we can finish the OSCE checklist today and start with the simulation tomorrow from morning itself. Anything else? Cover? So good. Let's have a round of applause. So I personally enjoyed all of you. You were so passionate, and just what we have covered since morning, we have covered with the overview of checklist, OSCE, and how we have to conduct the OSCE. So tomorrow onwards, we'll start with the simulation. So I think you will be more energetic tomorrow as well? Yes. Okay. Thank you so much. Thank you.
Tomorrow morning we'll have an introduction also.
Yes.
At 9 a.m. or 9:30 as per the